morning, everyone. Given that we have a long day, we're going to start. I know that Senator Whitley has a prime hearing at 9. I don't know where Sherman and Avard are. They're adults. Senator Rosenwald, there's Sherman.
Thank you very much, Mr. Chairman. For the record, I'm Cindy Rosenwald from Senate District 13, Nashua, and I'm happy to be here this morning to introduce Senate Bill 413, the Protect Our Veterans and Seniors Act of 2022. The purpose of this bill is to set aside a small sum of federal funds to commission an independent review of the impact of COVID-19, not only on the veterans' home, but also on our other long-term care facilities, to make recommendations to help the state improve our processes and protocols, standards, and rules in the area of public health and safety and well-being for our frailest elders and veterans. In a typical year during the budget process, the Veterans Home tells us that approximately 10% of their residents die from infectious diseases such as influenza or a diarrheal illness. But when this pandemic hit, it was much more devastating than that. And it actually led to the deaths of almost 20% of the residents in 2 months. We now have vaccinations and we have more PPE, but we're still having outbreaks. As of last week, 36 long-term care facilities in New Hampshire were reporting current COVID-19 outbreaks. Many of our nursing homes are closed to new admissions, despite the state allocating like an extra $45,000 per bed. But they're not able to accept new admissions because of COVID outbreaks. So we end up with people who are ready to be discharged from hospitals but can't be discharged because there's no nursing home bed available for them to go to. The result is that our hospitals are running basically at capacity, and a number of them have had to cut back on elective care or send patients out of the area. For many months, last year and the year before, families were unable to be with their loved ones in nursing homes. In March of 2021, basically before the broad availability of vaccines, the Department of Health and Human Services conducted an on-site assessment of the veterans' home. This was a limited assessment. They looked at availability of PPE, hand hygiene, surface cleaning, resident behavior testing and screening, and they determined that everything was under control. But they didn't evaluate, for example, how the isolation of residents could be reduced. And that seems to me important for frail elders, especially since 20% of the residents had just died. Furthermore, this assessment only looked at the veterans' home, not a broad segment of long-term care facilities. This bill is forward-looking. I think we can always do better and improve an excellent system. The pandemic hasn't gone away, and there will certainly be more outbreaks preventing our entire healthcare system from functioning properly. The bill appropriates a small amount of the federal relief funds, $250,000 out of more than $1.25 billion, to hire an independent outside consultant to help us understand how to make our long-term care settings safer. And I just would like to remind the members that the Senate phase of the budget appropriated $3 million of general funds to fix the road in Tilton that leads to the veterans' home. Shouldn't we be willing to spend less than 10% of that to help safeguard the lives of the veterans who live at the end of that road? And the additional over 3,000 Granite Staters who are residing in nursing homes. Thank you, Mr. Chairman.
Okay, thank you, Senator Rosenwald. Other questions of Senator Rosenwald? Okey-doke. You're all set. Thank you. The only other person I have signed up to speak on this bill is Kevin Grady. Good morning, sir. State Veterans Advisory Council.
Good morning, Mr. Chairman, members of the committee. For the record, my name is Kevin Grady. I am a 25-year veteran of our Air Force, and I'm a 23-year resident of the town of Hooksett, New Hampshire. Today, I'm here representing the 20-member organizations of the State Veterans Advisory Committee. And since we haven't seen you folks in a couple of years, I'll just kind of refresh you on what we do. We're chartered by State RSA 115-A:8 to speak for the veteran community. And one of the things that we do is, besides being a big information clearinghouse for help for veterans, is we look at bills that are coming before the Senate and the House that have veteran impact, and then we take a position on them. So it is in that capacity here that I'm here to talk to you this morning about this bill. And I'm also here to do two of my least favorite things in the entire world. The first is that I'm here to tell you that our veterans community doesn't support a bill that on the surface certainly looks like it would support veterans. And the second is that this bill, as I look at it, has a noble purpose. It has numerous high-powered, influential sponsors, and it has bipartisan support across the board. I hate having to testify against both of those obstacles, but what I want to tell you today essentially boils down to the discussion we had was that this particular methodology of trying to find information about this thing is neither going to be to tell us anything that we don't already know, we don't think, and we don't think that it's going to be timely. Basically, since the pandemic hit, if you can look at the phases of all of this, we had basically lockdown, and then we sort of opened up for a little while as we learned a little bit more, and then we had a surge the fall of 2021 or 2020 into 2021, and then vaccines came on board and things opened up a little bit more, and then we had Delta, we had Omicron. So what I'm trying to tell you with all of this is that over the course of now will be nearly 2 years of this pandemic, this situation has evolved constantly, and the need for our nursing facilities and our New Hampshire Veterans Home to evolve with it and make changes with it in real time is something that we looked at, and we said, if you're going to charter this bill by the fall and pick a vendor by, let's say, Christmas, we're going to get the results of this thing the summer of 2023. You know, the situation could change a lot between now and then. We'll also tell you that we expect that the people that would do this thing are going to be using the same communications methods, and they're going to be talking to the same people that other organizations are already doing. In other words, there are organizations in New Hampshire, like the Granite State Healthcare Coalition, that are already surveying, finding out best practices, passing them on in the nursing community. I read a report from DHHS, from the public health folks. They produced a 35-page report in May of 2020, which was a COVID response toolkit. And I looked through it, and there were a lot of good things in there in terms of infection control and how to wear PPE. There were links to videos to how to put on PPE. Because in our nursing homes, a lot of those people had never dealt with PPE before COVID. So we think that, you know, the Granite State Healthcare Coalition actually did multiple surveys of these folks within the last couple of years and produced a 200-page report that already lists best practices and doing all this stuff. we think that this particular bill, the vendor for this would rely on the same sources and methods that have already been in place and are already updating constantly as we go through this. We think that the response to this virus needs to be as nimble as possible. And we don't think that the 18-month time frame that we're potentially looking at here is going to meet that mail. I will share one statistic with you for our veterans home, because it was mentioned by Senator Rosenwald that DHHS did come and look on kind of a limited capacity in early in 2021 and take a look, and they found that everything was kind of up to speed. Yes, it did hit our veteran population pretty hard. Over the course of the last year, the average age of a veteran admitted to our veterans home is 83 and a half years old. And we all know that this virus is most lethal against the oldest of us, those folks that their immune systems aren't quite as strong as younger folks are. So it was a tough environment, and we didn't have a lot of tools in our toolkit that first year when we finally did have a COVID outbreak at the veterans home. But the statistic I want to leave you with is from 1 January until 31 December of 2021, not a single resident at the veterans home tested positive for COVID-19. No COVID deaths, not a single resident tested positive during that time frame. And that's a safety record that the New Hampshire Veterans Home is very proud of. In conclusion, I just want to say I know this bill has noble purposes. We just, in the the State Veterans Advisory Committee, don't think that it's going to produce timely results that are going to make, some substantive changes to the way that these folks operate. And that's all I want to say, subject to your question, sir.
Senator Sherman.
Thank you, and thank you both for your service and for being here.
Thank you, sir.
Did you talk to Senator Rosenwald about your concerns before testifying so
No.
that she could explain?
No, sir, I did not. I apologize for that. I didn't. It's hard for us. We have to wait until we get language on bills, and then when we have our meeting, we discuss it, and then it sometimes is difficult for us to catch up to sponsors. Our preference across the board on all of these things is if there's going to be a bill that has veteran impact, we would really much prefer that you touch base with us before you put the bill in, because I mean this session alone I have 5 bills out of the 18 we're following that we don't support, and I hate beating my head against the wall about that.
Right. Just a quick follow-up. Would you be willing to talk to her about some of your concerns?
Absolutely, I'd be willing to talk to Senator Rosenwald about it, and we have a meeting on Monday. Tuesday of next week. I'd love to have the opportunity to discuss this again with our members, get some more specific stuff, and then we'd be happy to sit down with Senator Rosenwald and see what we could do to make this something that we could support.
Thanks.
Further questions? Seeing none. Thank you, Mr. Grady.
Thank you, Senator.
The only other person signed up to speak is Mr. Williams.
Thank you, Cameron. For Senate Bill 413, we want to thank the bill's prime sponsor, Senator Rosenwald. We do understand the need that she's trying to address. We just wanted to reserve the opportunity, because I know Attorney Melissa St. Cyr was planning to be here, but she was unable to make it at this time. But we would certainly engage Senator Rosenwald if we had any concerns at all surrounding this bill. So otherwise, today, we certainly applaud Senator Rosenwald in her efforts in bringing the legislation forward. And with that, that concludes my testimony.
Other questions of John? All right, you're golden. Is there anybody else who wishes to speak? I'll close the hearing on Senate Bill 413. No, we don't. Next one's where's my? Oh, it is 9:25. Oh, all right, we got 10 minutes. Okay, we have 10 minutes before close loop. We will not go into executive session.
I will go on the website and I'll get your email address and I will email you and,
I don't know if you read the bill,
I did,
because it makes it clear that the report is due by this October. So it's not a year and a half, it's like 3 months.
in the fiscal note, the implication we got in the fiscal note was that the bill needed to be, contracted by the.
No,
that's when
the recommendations will be submitted by then. The reason it says fiscal year '23 is that starts July 1st. So typically legislation gets signed at the end of June or beginning of July. The money becomes available July 1st. And the report and recommendations as outlined in the bill are due out by October 1st of this year.
Yes, ma'am. And when I read the fiscal note, the way it talks about the RFP up here, and then it says this is what the RFP is gonna do, and your recommendations, that led me to believe the recommendations for who is gonna get the RFP had to be to the governor by the
No,
first.
that's not correct. That's why it's important to read the bill.
Well, I did read that portion of the bill, but
So I would agree with you if it were gonna take that long, but we're talking about 3 months.
okay.
And this is a resubmission of a bill from, last year. I think you guys proposed it last year.
I
It's
don't-
really the same bill.
I don't recall, but I can go back and look in my notes and see what we did on that.
It's essentially the same bill with a new year. Neil! Representative
Excuse me,
Kirk,
Senator Rosenwald.
how are you?
Good to see you.
Very nice to see you.
Like I said, I will
Great.
reach out to you.
Perfect.
So we have confirmation, and then I will bring this up again on Tuesday, and I will let you know.
Perfect.
Wednesday, And then if necessary, I'll send a letter to the chairman that says we changed our opinion or whatever.
Great.
on that, but I will definitely do that.
Thank you.
Thank you.
Well, if you guys can figure it out, I'm happy to go along with it. I'm sure.
Senator, can I ask you a question?
I think it was, I know, but. Okay,
I
all right.
started reading.
Yeah, yeah, yeah. Yeah, yeah, yeah.
So I
Yeah. I thought, yeah, the language was fine. I know, I know. We're already.
Hi.
If you need this seat when you're done, I'll leave. I'm here actually for 4:30.
Oh,
I'm just early to try to get a seat.
oh, okay.
All right, the time being 9:25, we'll turn on, Senate Bill 423, closed door controversy bill.
Well, mic drop. Gee. Thank you, Mr. Chairman, for that introduction. For the record, I'm Cindy Rosenwald from Senate District 13, and I am pleased to introduce Senate Bill 423, which establishes in statute certain privacy and security expectations for closed-loop referral systems that may be created for health and human services programs. As you no doubt recall, both the House and the Senate thought this was important enough to put in their respective versions of House Bill 2. That language, which started in the House and was amended by the Senate, is only session law, however. So public policy needs to be placed in the RSAs if it's going to continue. Before I discuss the specifics of the legislation, I'd like to just really quickly review what closed-loop referral systems are and what the context in New Hampshire is. So closed loop refers to when a referral from one provider to another is made for an individual to receive services, and the loop is closed, and the referral gets picked up and followed through on. It's a system that seeks to ensure people get connected seamlessly to the services they both need and want. Insurance carriers might have their own internal closed loop systems, but last year the state also had a contract for such a system as part of the Doorway's integrated delivery networks. Thank you. So last year, the state had a contract for a closed loop referral system as part of the Doorways, the integrated delivery networks. That contract was not extended, and the closed loop referral system was halted. But there is still a lot of interest among providers and DHHS. So establishing public policy in the areas of privacy and security for granted staters as far as their personal health information is concerned is very relevant, and that's what this bill does. I have with me, and I'd like to introduce Amendment 0170. I think you don't have it. Okay. It was my understanding that it had been sent out. It is a replace all amendment, and I'm pretty sure it was emailed out to the members. Okay. It is from Senator Gaida and me. So this bill with the amendment does several things, and I really would like to walk the committee through it. So if it's on the table, might we be able to get copies? Okay. I'm really sorry for that.
So here's what I'm gonna suggest, since there are a lot of people who are going to testify. this is what I'm gonna suggest, since a lot of people wanna testify, would you be willing to suspend and come back in a few minutes as soon as we have the amendment?
Yes, thank you, and my apologies for
Alright.
the snafu.
Jess,
I just have a question.
can you wait?
It's just a quick one.
Okay.
Thank you, Mr. Chair. So, Senator, what, I don't know to all the details of what was included in HB2, but with your amendment, are there significant differences about what was in HB2 and what's now in your bill as amended?
There is one provision in the replace all amendment that is different from House Bill 2, but the rest of it is very similar with some language tweaks, I think. You may
So what
hear
I'd
differently.
suggest is when we have the amendment and Senator Rosenwald walks us through it, you can do a compare briefly to HB 2. Okay? All right. Representative Edwards, do you want to testify now? Okay, great.
I'm Representative Jess Edwards, representing Auburn, Chester, and Sandown. I'm the vice chair of the HHS Oversight Committee. The reason I mention that is because as both houses showed concern in the trailer bill around the closed loop referral system, I ended up basically being the lead agent to work with DHHS to do a privacy review on the closed loop system, and it essentially tickled the opportunity to take a look at privacy issues throughout the department. I've introduced a bill dealing with privacy at an infrastructure level. This bill, I think, logically flows from some of the findings that we found in the report that's on file. There was tremendous unanimity amongst the Oversight Committee in the findings of the report. And I think that unanimity, for the most part, extends to this bill as well. I do want to acknowledge that the department worked with us to do that privacy review in a very collegial and cooperative way. I think they might take some issue with a couple of things in this bill. Generally, they seem to prefer opt-out versus opt-in. It's a way of getting permission to get somebody's privacy information, personal identifiable information. And so this is going to be an ongoing issue for years, I think, until we just finally get tired of wrestling with each other or we come to a conclusion. I would recommend that whenever possible, the department follow an opt-in approach. It's the appropriate way to respect the data ownership of the individual who lends their information to the state, and we do have a state constitutional right to privacy. So I think we're going to continue to have that conversation, and maybe this bill will help us drive a stake in the ground where it needs to be driven. It's particularly important for the closed loop referral system because this closed loop referral system basically empowers or enables through the technology to distribute personal data all around the state to anyone providing community-based services. And so, of all the systems we have, this one will exist out in the wild more than most. And so establishing the principle here, I think, is important. With that, I'll take questions if there are any.
Thank you. Thank you very much, Representative.
Thank you.
Mark, why don't we try to hear from Representative Kirk? Good morning. How are you?
Mr.
You don't look a day older. I hope you're happier.
I am very happy.
Good.
You're right. For the record, I'm Neil Kirk. I live in Ware, and I'm representing myself. And I come in support of the bill, and especially in support of the amendment. My concern with this subject has to do with the privacy of identifiable individuals' medical and social service information. As many of you know, personal privacy is an issue that's concerned me for decades. Prior testimony has made clear the privacy issues at stake in a closed-loop referral system. HIPAA provides some privacy protection for medical records, but none for social service records. The bill as amended goes beyond HIPAA by putting the individual in charge of deciding which of his or her medical and social service providers get to see his or her personal information. That to me is crucial. The individual decides, not the system, not the provider, but the individual, the patient. So, to gain the benefits of the system and simultaneously protect the privacy of individuals who use the system, the bill as amended allows individuals to choose whether his or her personal information may be included in the system or only given to a particular service provider. Requires the consent on each occasion in which the individual engages with a different service provider. Bars members of the system, service providers, from accessing an individual's personal information unless they are providing services and get the individual's consent. It does, however, give HHS consent, without any consent, access to the personal information of individuals for which it pays, such as people who are on Medicaid. This is good policy for the live free and die state because it puts the individual in charge of his or her personal information in the clearest manner. The private right of action in the amendment provides additional protection should the department, a private entity, or a member improperly access an individual's personal information. In sum, the amendment provides real privacy protection, and it's far superior to what exists in House Bill 2. Importantly, the bill as amended is consistent with the recently adopted Constitutional Informational Privacy Amendment. Thank you. I'd be pleased to answer any questions if the committee has any. I would only reiterate that there are some folks who think that a single consent on the part of an individual is sufficient. And the problem with that is too many providers that the individual isn't aware of, who may not even be members of the system at the time the consent was given, would have access to personal information. This is New Hampshire. Let's make sure everyone decides who gets to share the information that he has put into the system that relates to him. I'd hate for my neighbor who happens to work for an organization, let's say, that provides food stamps, provides food in the food pantry, or some sort of psychological services, gets to know about me because she has access to the system, and I didn't have an opportunity to consent to her or her organization seeing my records. This bill will prevent that, and I urge the committee to adopt it. Thank you, Mr. Chairman, and again, if there are questions, I'll answer them.
Thank you very much, Representative Kirk. I have to say publicly, you haven't lost a tick off your fastball.
Thank you, Mr. Chairman.
Are there questions of Representative Kirk?
Just one.
Yes, Senator Avard.
Thank you, Mr. Chair, and thank you, Neil. You do look the same. It's great, whatever you're reading. On page 2, there is an
Of the amendment?
Yes. On page 2 of the amendment, the aggrieved may bring civil action. So if there is a major breach, this could be catastrophic to the organizations that are providing these services or whatever. Is 10,000 excessive or per case on line 7?
Yeah. The private right of action is designed to make it clear that there are consequences of a breach. If I were If I had written this, I would have put in 1,000, okay? Because that makes the point without making it excessively expensive. But the private right of action, I think, is important. Could the bill do without it? Yeah, you could eliminate this and the bill would still be good. But this really makes sure that folks understand that the state of New Hampshire is serious about protecting personal privacy, and there are financial consequences if you don't. But if you went down to 1,000, that'd be fine.
Okay, seeing no further questions, thank you very much and good to see you again. Senator Rosenwald.
Thank you. Dorian Gray. Okay, so I think you all have the amendment.
Yep.
So let me just say what House Bill 2 did. The House version of House Bill 2 said there would be no further expansion of a closed-loop system beyond the Unite Us contract that was in effect at the time until Health and Human Services looked at this and issued the report that Representative Edwards referred to. The Senate added basically 2 more provisions, which are continued in Senate Bill 423, but would go into statute instead of just being session law. The first is that the Department of Health and Human Services would not be able to access an individual's identifiable information who is not receiving services funded through a department program. That is still part of Senate Bill 423. And the second thing that the Senate version of House Bill 2 said, that an individual had the right to opt in to a closed loop system on each referral and could also revoke their consent to be in the system. That also is continued in Senate Bill 423. So I would say the only thing that is actually new is the private right of action. So if you all have this now, I'd like to just walk through it, if that is okay. The first part of the bill from Senator Guide on me is that it establishes the right of individuals to keep their private health information away from state government if they are not receiving services paid for by the Department of Health and Human Services. DHHS is, and this is on page 1, lines 7 through 13. The department is prohibited from accessing individually identifiable information or protected health information, that's a HIPAA term, unless the individual affirmatively consents on every referral instance. Beginning on line 14, page 1, the specific language the department would have to use to obtain that consent is laid out here. And the purpose of including this language in the statute is to make sure the individual is asked in language that's easy to understand. Lines 19 through 21 on page 1 close a loophole in the HIPAA privacy law. Under HIPAA, if a covered entity, which is a provider, an insurer, or certain billing companies, if they suspect there's been a breach that exposes an individual's private information, they have to investigate that potential breach. But they do not have to inform the individual that their information has potentially been exposed. The entity is under no obligation to tell someone that their health information might have been exposed unless they eventually determine there was a breach, which HIPAA itself defines pretty narrowly. So, for example, If the breach didn't include a lot of people whose information was exposed, or no harm was done with that information, the individual never actually has to be told that it even happened. And this is not just theoretical. This actually happened in New Hampshire. I want to say maybe 8 or 10 years ago out at Wentworth Douglas Hospital, there was a pathology lab employee who sent people's biopsy results to the wrong doctors. And in some cases, those doctors were in Maine. The individuals never had to be told because the hospital eventually determined that it wasn't a lot of people and nothing bad happened to them. So therefore, it didn't have to qualify as a HIPAA breach. And the individuals never actually had to be told. This has bothered me for a really long time. So the bill takes this small but important step not to change HIPAA, but it does have to help the public by saying that if the contracted entity running the closed loop referral system does eventually determine there's a breach, they have to begin to notify people within 48 hours of making that determination. It could still be weeks or months before they make that determination, but the 48 hours is consistent with a notification provision that had been in the contract that the state had undertaken. So I don't think it's too onerous. Still on page 1, lines 22 to 31, make it clear that people have the right to opt into the system at every referral for services, and that they can revoke consent at any time. HIPAA requires retention of protected health information for a certain period of time. I think it's 7 years. And some state programs also require retention of information for a specified length of time. But as the Honorable Mr. Kirk said, not all of the information that would be in a closed loop system is covered by HIPAA. So medical information would be, but social service information wouldn't be. So these lines make it clear that to the extent allowable under federal or state law, if the individual revokes consent to be in the system, their private information must be quickly deleted. It doesn't try to change existing federal or state law. It just says where that doesn't exist. If someone says, no, I've changed my mind, the vendor would have to act quickly. Page 2, lines 1 through 4, we clarify that the provider organizations can only access information on an individual if that person has been referred to them for services and further has consented to allow the provider to access their information through the closed loop referral system. And finally, beginning on line 5 is the private right of action if any provisions of this new policy is violated. This is done in other areas of statute. I picked up the language from there, and I think it's an important part of protecting the security, really, of very private information. As I learned from Representative Kirk, privacy is what you protect, and security is how you protect it. And I think those are really good definitions. So, Mr. Chairman, I have heard that some vendors and providers worry that protecting the privacy and security of re-implementing a closed loop system could slow down the process of contracting. And I would say two things about this. First of all, there is no contract currently in place. So an RFP procurement process would take the normal amount of time that contracts take in New Hampshire, but that process provides an important transparency and accountability assurance necessary when we're dealing with significant amounts of tax dollars. We need to get it right both on the public policy, but also on the expenditures. I think the hospitals have some questions about the consent and revocation process along with the management of information process. To me, I'm confident they can be addressed in contracting these issues for any future contract. The department wants to suggest some language changes, and I have concerns about the first of their suggested changes because it expands the number of people the department could have information about. But on their other changes, I think they're minor and I'm fine with that. I'm completely neutral on the subject of whether or not closed loop referrals are good or not good. But if we're to move forward, I strongly believe we have a duty to protect the privacy and security of Granite Staters. So with that, I'm happy to answer questions.
Okay. Senator Sherman.
Thank you, Senator. I have a couple of questions.
Yep.
Lines 29 through 31 of the amendment. When an individual, well, help me understand the system. There's a network system, and then there's the individual vendors. And those vendors have records. Is this referring to the network's records, or is this referring to the individual vendors' records?
Thank you for the question. This only refers to the closed loop referral system. So if I decide that I want to revoke my consent to be in it, but I'm referred to your organization for housing assistance, you still have information about me in your records, but the information about me would have to be deleted from the system if that was allowable. As a social service, I think that would be allowable. If I were referred to you for medical care, it would not be.
So, just to be absolutely clear, that vendor would not have to delete that information. The system that you're in would.
Correct.
And the concern there obviously is if I'm any kind of business, I'm not going to delete everything within 7 days because then they could come after me for it. I mean, it's just the liability implications of that would be huge.
Well, and I would also say that if you're continuing to provide services to someone, you need to know
Right.
who they are and what you've done. So
Right.
this refers to the closed loop referral system that the state would privately contract or possibly build itself, but I doubt it.
So I just wanted to log in there. I share Senator Avard's concern about the $10,000. That could be a game changer for many nonprofits and for people involved. Are you open to the idea of dropping that down to $1,000 per breach?
I would rather see that than eliminate the private right entirely. I would also frankly say that other state law has $1,000. That could be considered low, but I would be able to live with $1,000.
And one last question. I think I understand this. You're talking about security versus privacy. I think those were the two words you used. If there's a data breach, and looking at the private right of action, under an earlier section, you're talking about, I think it's 19 through 21 on page 1, you're talking about becoming aware of a data breach. The individual vendor, if they're hacked or there's a malware or some kind of cyber attack, they are not, this does not hold them liable. It only would hold them liable for not informing, correct?
This only refers to the contractor who is providing the closed loop system, first of all, and only to the extent that the provisions of this section of statute are violated. HIPAA already has enforcement mechanisms and fines for violating the HIPAA privacy rule, and they're big, 250,000. I don't think they've ever done it. And the states now also have the ability to enforce HIPAA. It's a relatively recent change, but this only applies to the vendor of the closed loop system.
Senator Whitley. You said that you were on the last question.
Yeah, it was part B of the last question.
Senator Sherman.
Lasting question.
I just want to clarify this, that the vendors, everybody's under cyber attack right now. Hospitals are particularly vulnerable. So the question here is, what is the liability for these vendors? Is the liability if they don't inform the person of the breach, or are they liable for a cyber attack?
When you say vendors,
Or the system,
okay, it would be probably one vendor
Okay.
per contract.
right?
Their liability would be for not HIPAA violations, but for violations of this section of statute. So if somebody said, I revoke my consent, and they didn't delete
I got it. Thank
So
you.
where
not for
possible.
not for the hacking breach.
Right, for the violation of these provisions.
I thought that was your question.
It was my question.
All right, Senator Whitley.
Thank you, Mr. Chair. Thank you, Senator, for clarifying some of that, the parts of the amendment. So, I have a sort of personal and professional, commitment to addressing social determinants of health. And, I think we know in New Hampshire, sort of in the country, that social determinants of health are really responsible for a lot of our health inequities. And, just for clarity, those are those sort of unfair, avoidable differences in our health status. And I think they are avoidable. So my concern is that, with this opt-in rather than opt-out system, do you think that the state can adequately address these social determinants of health to improve health? Like how will we be able to target resources to those people and continue to have a significant influence on population health?
Well, thanks for the question. I mean, I guess we have to ask ourselves, is the state responsible for making improvements to the health of people for which it is not involved? And we might each answer that in different ways. I believe that if you are in need of heating assistance, and you're not going to get it from the Department of Health and Human Services, I don't think they need to know who you are. They need to know de-identified aggregate data, which this doesn't address.
Thank you.
This is only about you as Becky Whitley, not you as a woman in Merrimack County.
Senator Raybard.
Real quickly, and thank you, Mr. Chair. Just getting back to the $10,000. I didn't suggest 1,000, but 1,000 seems to be the standard. But screaming would be 2,000. Would that be acceptable if we dropped the fine down to 2,000 per incidence?
I don't think it would be accessible because I could live with 10,000, as Senator Gaida and I introduced.
Okay.
We're really serious about this. And I never believe that contractors are going to violate state law or that the state would violate state law. But I think sometimes we have to back up our words with something tangible.
Teeth, okay, yeah. Okay, thank you.
Seeing no further questions of Senator Rosenwald, thank you very much. Senator Gaida, you indicated you want to speak at the end. Okay. I'm just looking at the sign-up sheet. It would be that time that if somebody was opposed to this bill, I'd give them the opportunity to speak. Nobody has signed in that wants to speak who's opposed to the bill. Anybody want to? Who's opposed? Okey doke. Wow. Amazing. All right. John Williams and Mr. Wieters.
And Senator Bradley, it will actually be Attorney Melissa St. Cyr. I'll bring her in.
Oh, do you want to wait until Melissa gets here?
Oh, sir, I'll just
Oh, okay. She's not on the list, but that's all right. Go ahead, you might as well start.
Thank you. For the record, David Wieters, Information Services Director for DHHS. Thank you for this bill, and we definitely see a need for privacy culture in the state of New Hampshire. And this bill actually provides the direction and needs for how we would move forward with the closed loop referral. As Senator Rosenwald introduced, we did have a few changes or alternate language opportunities to further clarify the goal of this bill. Sorry.
Hi, everyone. For the record, Melissa St. Cyr, Chief Legal Officer for the Department of Health and Human Services.
So on page 1, the lines 7 through 10, this is the lines that change that Senator Rosenwald introduced, that she said that she had some challenges with our change. And what we were looking for is where it reads, unless the individual is currently receiving services funded through a Department of Health and Human Services program, we were looking to see if we could add or has received. And the reason for that change, where it would say currently receiving or has received, is without having the ability to look at the person's information that they have previously received services from us, the Department of Health and Human Services, we run the risk of actually providing the same services that may or may not have assisted them in the past. So that duplicative effort not only wastes our taxpayer dollars, but also may run the risk of adverse outcomes for those individuals. So we were looking to modify that so that we could have the information for currently receiving as well as has received services.
I'm going to interrupt you right there.
Certainly.
What if that phrase were included and said something like whose consent had not been revoked previously?
Did you want?
All right,
From-
I'm just putting it out there.
From my perspective, I would not have any issue with that addition.
Okay.
Because again, that would be in conjunction with the individual's right to revoke access to that information. And so if they didn't want DHHS to be able to have that information, then we would be able to move forward with the services based off of their consent for future work.
Okay, go ahead.
Then it's the same page, lines 11 through 13, where it indicates, notwithstanding the foregoing, the department may obtain specific consent from an individual to access the individual's personally identifiable information or protected health information on each instance of a referral for services provided that in obtaining consent, each instance, we were looking to make a change to on each consent for a referral for services. And the reason for the distinction there is that when an individual may present themselves at an emergency department or at a community mental health center, they may be assessed to be provided referrals to multiple different social services as well as healthcare services. And at that time, we would propose that consent would indicate I'll give an example, the domestic violence shelter that they would be referred to, the food pantry that they would be referred to, and potentially the community mental health center that they would be referred to. So that individual would be presented with a consent for all three locations, as opposed to having three separate consents and three separate signatures at that same time, which may provide difficulty for a person in crisis to understand, why am I signing the same information three separate times? So in order to streamline, we were looking for an individual consent that would further indicate how we're sharing, who we're sharing the data with, but then to streamline that process so that they can get services more effectively and expeditiously.
Could you just cite that language that you're looking for again?
Certainly. So right after protected health information on each strike instance, and then add in consent for, and then strike of. So it would read protected health information on each consent for a referral for services, provided that in obtaining consent, and it would continue on from there.
Go ahead. Yeah, since we're like going through this line by line, we're gonna do it a little differently. Go ahead, Senator Sherman.
So would that consent, you just identified in your example 3 different possible places where you want information. Would that single consent identify those 3 spots? So they would have a single consent, but it would still be saying, you're gonna let us do the, I'm trying to remember, the domestic violence shelter, the nutritional, or the food bank, and there was one other.
Yep.
If they say, well, I'll give you 2 out of the 3, will that be in the consent? Is there a way? In other words, they're getting to the same thing that Senator Rosenwald is doing. You're just doing it in one-stop shopping. You're saying there's one consent for all, but they would have to say, yes, for each one that they're going to. Would that solve your concern, but also keep it consistent with the spirit of this amendment, which is to make sure that for each instance they have a right to say no? You understand my question?
Thank you for your question. Yes, I do understand your question, Senator Sherman. That would be in line with what our thoughts were. It was the individual would be informed of who they're consenting to share their data with in that single consent. If they chose and indicated, I know someone at that community mental health center, please don't share my data with that person.
That's what I'm getting at.
Then we would only share the consent, then would strike that third provider and only provide consent for the 2 providers that they're consenting to share data with.
So very quickly, I think we just need to make sure that's clear in whatever language you're recommending.
Okay.
Yeah, because I'm not sure it is, but that's.
I'm not sure it is either. So.
The only other component, and again, we signed in as neutral for this, and we're not opposing the bill, was in page 2, lines 1 through 4, where it indicates member. We would recommend replacing that with provider, as member in many cases in Department of Health and Human Services indicates an individual receiving services from Medicaid, for example. So in this case, no provider utilizing the closed loop referral system. I believe the intent was to ensure that the providers that were being provided this information or consented to by the individual was that they would be held accountable to utilize, protect the privacy of that, and only have access if the individual consents for that provider to have it. So where it indicates member, replacing it with provider was our only alternate language.
Senator Avon.
Yeah, thank you. Getting back to the signature situation there with, when you buy a house, it just, sometimes you have to sign here, sign here, sign here, initial here, initial here. Could there, I'm thinking gel car and rules and making up rules and stuff like that and how this would be applied. Is it possible that you could have one signature but initial, okay, this provider, you can send this information there, this provider, you can send information there, but this one, no. I'm trying to stay with the spirit of the bill. I'm just thinking would an initial work just as well as a signature consent. Does that make sense to you?
Thank you for the question. I certainly understand that the question. I'm not exactly sure. Like if I understood you properly, then if we were referring to 3 different providers, there might be a line for each provider where they would initial and then a final line that signs saying I agree with
Correct.
everything prior. That would be something we would need to work with and see if the vendors can provide that, but that certainly could be a requirement that we could put in a future RFP type solution. So
Rather than 3 signatures, just 1 signature and initials is what I'm getting at, I guess.
the current practice, and I'm not saying we couldn't do it from a technology perspective. You certainly can do it, but from a current practice, when you go to like a hospital or when you go to these facilities, they have a signature pad to essentially sign for your consent to treat and payment and operations. The idea was to take that same strategy that's been worked in healthcare for many years and apply that to not only healthcare but the social service process to ensure that we were obtaining consent, providing the information to the individual as to what they're consenting to, but not unnecessarily add additional steps that may cause confusion to an individual that's in crisis. So I'm not saying that cannot be done. It's just not current practice.
Senator Gray.
Both line 1 and line 3 on page 2 have the word member. Are we replacing that with provider in both instances or one?
Thank you for the question. I believe in that lines 1 through 4, member is indicated 3 times. So it replace, if we would put, it would read no strike member of and say provider utilizing the closed loop referral system network shall have access to an individual's personally identifiable information or protected health information unless the individual has been referred to that strike member, replace it with provider for services, and the strike member, replace it with provider, requested consent from and was given consent by the individual to access such information. Did that answer your question?
Yeah,
Senator?
I just wanted to make sure the clarification.
Thank you.
All right, so the question I have, if there are no other questions, going to some of the discussion that we had about the $10,000 for each violation. If the figure is that high, and it seems to be from the testimony we've received higher than other states, is that going to preclude robust competition for bidding? Is it going to drive up the cost potentially? What are your thoughts on that?
Hi, thank you for the question. I certainly think that could be an impact. It's hard to say at this time because it's not something that we've dealt with before. But absolutely, providers have concerns around any type of private right of action, and so it could potentially impact any of our bidders.
So would you advise us to lower it to that $1,000 fee that is, or threshold, that's been bandied about, and we could see what happens?
I think if the committee so chooses, that would be a good step. Certainly we'll ensure, and we should ensure not only through this legislation, but from the application of the closed loop referral system, that whoever we do engage has appropriate protections in place so those things don't occur.
Okay. Yeah, All right. I guess what I'd say is, I don't know that we'll be able to exec this bill today, but it seems like we might be pretty close. If there is an opportunity to finalize language with Senator Rosenwald, that's a possibility, I suppose. So, thank you very much.
Thank
All right, so, again, I have no one signed up in opposition. We'll go right from the top, pull them in a hand, signed in neutral, and obviously wants to speak.
When I take off my mask, I take
And
off my
while
glasses.
you're
yes.
speaking, I have to introduce the Physician's Assistance Bill.
Yep.
Across the street, Senator Gray.
Okay. And I will be quick. I know you have a busy schedule. So I just want to, for the record, good morning, Mr. Chairman, members of the committee, Paula Minahan, Senior Vice President, State Government Relations with the New Hampshire Hospital Association, representing all our hospitals. We did sign in neutral on this bill, and we do have some questions that have actually already been raised. I won't go through them all. You have them in my testimony. It has to do with, the process of consent and how that would all work. Obviously, our hospitals are directly impacted by this bill, so in the closed loop referral system, we just want to make sure that it's manageable. But they do have a direct and tangible impact on all healthcare providers and social service agencies that are likely the place where consent will have to be asked and managed. While we strongly support the importance of privacy and protection of health information, there needs to be the appropriate balance of privacy and protected information and the ability of a closed-loop referral system to function effectively. We ask that the committee consider all of these direct and indirect implications of passing these requirements as outlined in this bill. A closed-loop referral system is an important tool in addressing social determinants of health needs in our state, and by connecting healthcare organizations, including DHHS, with community service providers on a single statewide technology platform, it would streamline referrals, foster easier access to vital services, and provide important confirmations when health and social services are delivered to individuals in need. Hospitals and their health partners are an important link to this process, and we are supportive of establishing a closed-loop referral system in New Hampshire to support these efforts to improve our population's overall health and social well-being. And thank you for the opportunity to provide our comments.
And thank you. Are there any questions from the senators? Seeing none?
Thank you.
Thank you very much. Next one on the list is from Unite Us. Carlos, come on up.
Thank you, Senator. Good morning, Senator, members of the committee. Thank you for having me today. My name is Carlos Zudiarte. I'm Vice President and Regulatory Counsel with Unite Us. Unite Us was founded in 2013 by two veterans who were having experiences returning from active duty and recognized the challenges that veterans faced in getting connected to social care. And so they built a platform that not only would provide access to information about service providers, but also ensure that those veterans were getting connected to the care they need. They then quickly realized that this was a problem that was not only faced by veterans, but was faced more broadly across the country, and that addressing social determinants of health was important to help addressing health outcomes for a variety of communities. We know that 80% of an individual's health is impacted by the social and environmental factors beyond what happens in a clinical setting. And that's not just about improving health outcomes, to be clear, right? This is about reducing the cost of healthcare that is being spent, including by Medicaid programs in the state. In September 2020, the Department of Health and Human Services launched a closed-loop referral system in the state in partnership with Unite Us, primarily to address the impact of the pandemic, as well as to help address the opioid epidemic. And a big part of addressing the opioid epidemic was onboarding substance use disorder treatment programs, as well as mental and behavioral health programs, with a focus on the Doorways programs across the state. Now, we know from our experience launching these statewide networks across the country, that information sharing is vital to connecting people with the care they need. And we've heard from our partners how breaking down those silos between the healthcare setting and the social care setting are incredibly important to helping connect their members with the services they need. And that is particularly true with people who are experiencing substance use disorder, because they so often have other issues beyond just that treatment for their substance abuse. I want to point you to, if you'll excuse my reading for just a moment, a quote in our testimony that relates to from the Adam Moulton, who's the director at Reverend House in Laconia. And he says, in order for a client, or in my case, a resident, to get the highest level of care necessary, there needs to be solid communication and interconnectedness within all of the resources. We are unfortunately struggling with an extremely terrible mental health and drug epidemic, so allowing that communication and interconnectedness and really creating a 360 approach for all of my residents is necessary to make that happen. So I want to make sure that it's clear, we support privacy protections and have built the system, the closed loop referral system, and in our case, the Unitas platform, to prioritize those privacy protections. And in particular, the way the platform is built is that the only people who would have access to anyone's information are individuals who are actually providing services to those individuals. And we also want to recognize the hard work that went into crafting the language in HB2 last year, which we think does a really nice job of striking that balance that the Hospital Association was talking about earlier between information sharing and privacy. And in that bill, it included two things that have come up today that I think are really important to highlight. One is, right, it restricted the department's ability to access information for individuals who they were not serving. And two, it included that opt-in language that I know is important to a number of the senators. And so, as we're talking about SB 423, we do have some concerns that the language in SB 423 goes beyond that. But again, we are supportive of legislation that would codify HB2 into permanent law, recognizing that HB2 was session law. I also want to just pause for a second on the discussion that we've been having about the private right of action, and just point out that much of the concern there relates to the fact that, one, this would be unprecedented and would be very specific to an individual contract, and two, there are protections in law as it exists at the state and federal level, and remedies for both individuals as well as for the department and the state if there were ever to be a breach. And those include remedies that are going to exist in the contract. The concern with a private right of action at any dollar amount is that it incentivizes individuals to create litigation risk for the vendor, and frankly, as the amendment is written, for the Department of Health and Human Services that could have a significant impact on the state budget. So I just want to make sure to call those concerns out. At the end of the day, to me, this is really about the individuals who can be helped by a system like the closed loop referral system. And again, if you'll excuse me for just 1 minute, I want to make sure I get this right and just share a story about one of the clients on another network that received support through the Unitas platform. And to be clear, the client has given consent for us to share this story because they recognize the importance and the power of sharing individual stories about how these networks can help people. So this client had been living at the Salvation Army. They were enrolled in monthly shots to address their health issues, was having problem finding transportation to the clinic, and so they were missing some of those shots. Through the platform, they were able to connect not only with regular transportation, but also to a permanent housing solution so they could transition out of the Salvation Army. And again, that solution came because not only were they able to get connected directly through a network of organizations who had committed to participating in the network, they were able to close the loop on those referrals, but they were also able to do that for someone who had these different needs beyond just, it wasn't just one phone call, right? These are multiple needs that could be addressed through the technology. And so, as we consider the next steps here, I would say that, we're firmly in support of codifying those protections in HB2. We believe that that strikes the right balance here. And some of these additional provisions, we do have concerns would negatively potentially impact the process of connecting people with care, as well as potentially slowing down the RFP process that we know is important to move forward here.
Questions? Yes, ma'am.
Thank you, and thank you for your testimony. So I am really hung up on the issue that you identified is that, that we need to strike this balance, and I appreciate your understanding of the, in New Hampshire, how important privacy is, but striking that balance and making sure we're connecting people to what they need. And in particular, I think you identified, folks that have struggled with substance misuse disorder, struggle with mental health. Like, we know in New Hampshire, like particularly in the fight against homelessness, the state has identified a housing first model that says, look, we can't even, support these folks in their treatment if we can't first get them housing, or if we can't first stabilize, these basic needs. So, so I'm curious in particular about like this balance, and so I'm wondering your thoughts about that.
Yeah, absolutely. And thank you, Senator, for the question. I really appreciate it. Again, there were 4 key provisions. I'll just go through the 4 of them now since we're talking about it in HB2. And again, we think these are important provisions that provide those protections for privacy, but again, help us get to that balance that you described, right? And, that is 1, the restrictions on DHHS accessing the information. 2, those breach notification requirements that Senator Rosenwald spoke so passionately about. 3, the opt-in requirement at each referral. And 4, it's that the ability of an individual at any point in time to withdraw their information from the system, recognizing, again, the constraints that Senator Rosenwald spoke about. And again, we think that's the right balance because we recognize that the organizations here that we're leaning on to provide these services are stretched incredibly thin as it is, and are doing everything they can to focus their resources on connecting people with care. At the same time, we know that those traditional silos that exist between the healthcare setting and the social care setting have made it more difficult for people to get connected to care, and that those challenges particularly impact the most vulnerable members of the community. And so we want to make sure that we don't add additional barriers between that information being shared in a way that is completely consistent with transparency, clear communication about what the individual is agreeing to, and that consent that we've built into our process.
Okay, seeing no other questions, thank you very much.
Thank you for your time.
Next, from Find Help, Gray.
Excuse me. Thank you, Senator. Good morning, members of the Senate Health and Human Services Committee. For the record, my name is Aaron Gray. My company, Aunt Bertha, runs findhelp.org, which is the largest closed-loop referral network for social services in the United States, with more than 8 million users that we serve. We are a public benefit corporation based in Austin, Texas, and we're proud to say we've earned the trust of more than 400 customers nationwide, from state governments to health and social service organizations throughout the country, including some that serve and do business here in the state of New Hampshire. Thank you to the committee for granting me the privilege to speak today. I appreciate the hard work of the HHS Oversight Committee, and especially the sponsors of this critical legislation. We think New Hampshire is on the right track in seeking to protect individual privacy interests when discussing closed-loop referral systems, and we support Senate Bill 423 with the Rosenwald GIDA amendment, and we appreciate the hard work of the Health and Human Services Oversight Committee in making its recommendations as well last year. Many people are aware of the privacy protections that guide medical information under HIPAA, but many do not realize that federal privacy protections for an individual's interactions with social services are unclear and ambiguous. Most social service providers are small, community-based organizations. They provide needed social services, but they typically are not covered entities under HIPAA. Thus, they are not guided by the same privacy protections and policies that are required by traditional healthcare providers. More importantly, there's often a stigma that comes with needing social services, so it's important that we recognize that this stigma exists and that we respect their right to privacy. Social services exist to help people during their time of need. We've all been there. These are some of our most vulnerable moments. Many people needing these services are newly unemployed, survivors of trauma, ex-offenders trying to make their way back into society, or parents helping their struggling teenagers. People expect this deeply personal information, which is housed in closed-loop referral systems like ours, to only be visible to the people they trust, people they know, people they've actually met. New Hampshire has become a leader in this area. Other states that we have spoken with are now looking to New Hampshire's work for guidance. The importance of SB 423 with the Rosenwald Guide Amendment is not just for New Hampshire, but for other states around the country grappling with the issue of how to coordinate care without abandoning the rights to individual privacy. This bill does not hamper care coordination in any way, in our opinion. Critically important to this discussion is the need to have consent on each instance of a referral to ensure that any organization receives the consent of the individual before their sensitive and personal referral information is even looked at. With technology, a per-referral consent is a way to appropriately limit access to parties that shouldn't have access. If an individual wants to share his records with the people he trusts, perhaps a social worker at a local nonprofit, he can do that in a per-referral consent model. This bill is about access and ensuring that the right people have access to the right information at the right time. Now, with an open access consent model, any user with a valid login and a password to a centralized database, even somebody in another town that you've never met or never talked to, can look you up and see your information if you've received social services in the state. In some cases, like healthcare, that model works. If I show up to an emergency room unconscious, I want the ER doctor to know about my medical conditions. But to govern access to deeply personal social services information the same way, it's a lot riskier, as this database contains information about people's most vulnerable moments. While an open access consent model may allow for convenience, we strongly believe that people won't seek the help they need if they fear their information will be seen by the wrong people. Many in healthcare are working to address social determinants of health because studies show that if people's basic needs are met, they tend to be healthier. We agree with these efforts and support over 400 organizations, including 102 health plans nationwide, in being their system of record for social determinants of health. We've helped millions of people using a model that is driven by informed consent at each instance of the referral. It hasn't hindered care coordination, and most importantly, it respects the right to privacy of the individual. So we support this effort to establish parameters on the development of a closed-loop referral system in New Hampshire, and we hope New Hampshire's efforts are emulated in other states. I'm happy to answer any questions if you'd like.
Questions from senators? Thank you very much.
Thanks.
Next on the list, New Futures, John Barry. Did you see if he's outside? There he is. See, we didn't forget you.
That's it. I didn't forget you guys either. Thank you.
All right.
Thank you. Can you hear me okay?
Yes.
All right. Good morning. Sorry? Thank you, Senator. All right. Good morning, honorable members of the committee. My name is Jake Berry. I'm the Vice President of Policy at New Futures. As many of you know, New Futures is a nonpartisan, nonprofit health policy and advocacy organization. We've been working for more than 20 years to address substance use and mental health issues in our state. I'll be very brief this morning. We don't have a formal position on the underlying bill, and I haven't had a chance to read the amendment, but we do feel very strongly about the closed-loop referral system and the impact it's had on our work to overcome New Hampshire's ongoing addiction and mental health crises. Since it launched in 2020, the system has played a pivotal role in enhancing care coordination and connecting individuals and families from across the state to needed behavioral health treatment. With our behavioral health crises only magnified by the ongoing COVID pandemic, this system is needed now more than ever. I would encourage the committee in your deliberations, to ensure that this bill will not cause any further delays or disruptions in reestablishing the closed-loop referral system. It is just critical to our state now. Thank you, and I'm happy to take questions.
Questions? Thank you very much.
Thank you.
Senator Geiger, you're the last one on the list.
Thank you, Mr. Chairman and members of the committee. We live in interesting times. For the record, Bob Guida, Senate District 2, and a member of the House and Human Services, Health and Human Services Oversight Committee, and worked this summer past on developing what became the basis for this legislation. Part 1st, Bill of Rights, Article 2B states, right of privacy. An individual's right to live free from governmental intrusion in private or personal information is natural, essential, and inherent. Let's focus on that word inherent. It doesn't mean subject to the convenience of a vendor or a system. It means it is extant to the individual's existence. It's not subject to convenience. It's not subject to price, nor should it ever be. That amendment was passed in 2018 by 81% of the voters of this state. It's a very strong statement. Nothing in this bill prevents the sharing of data as necessary for a person to receive services. What the bill does is essentially implement Article 2B, Part 1st of the New Hampshire Constitution, that affects every citizen in the state. It does not prevent services, it just merely makes an individual aware that this information may be going certain places. Under New Hampshire law in RSA 332, it's made very clear that the individual is the owner of the healthcare information, not the state, not Medicaid, not Medicare, the individual. Again, underscoring once again our duty as elected members from the folks we represent to protect their constitutional rights. We don't take an oath to protect health care. We don't take an oath to protect systems or vendors. We take an oath to protect the Constitution and the rights therein. And 423, as written, as amended, does exactly that. HHS, in their suggested amendment, anyone that's currently receiving services can also sign a consent form when they come in to get those services. It's a matter of implementation. And while there might be a burp up front, nonetheless, a change in the law should be made known to every receiver of those services, and it's easily done with a consent form. With respect to Senator Abart's suggestion of one form, but detailing specifically which vendors are going to, or which providers are going to get that information, that's doable, okay? And it's sensible. As far as member or provider, we can discuss that, but provider has HIPAA denotations, and we want to make sure, as we work on possible amendment to this, that those denotations do not, in fact, conflict with our constitutional rights of our citizens. Again, I'd like to restate that nothing in this bill prevents the sharing of information. It merely requires those who wish to use that information or to share it, in this case the vendor, to inform the individual and in fact to provide that individual with a level of comfort that we are aware and we are in fact complying with the expressed will of the people of this state as amended recently in the Constitution. I'm happy to take any questions.
Senator Guida, I don't see any questions. So I'm assuming you'll work with the department, Senator Rosenwald, and others on any amendment.
That's correct. Thank you, Mr. Chair.
With alacrity.
Does that mean quickly?
Yes. Yeah, all right, great. Unless there's anybody else that needs to speak, the first time, second time, we're going to close the closed-loop hearing, and we'll take a 30-second break and open the hearing as soon as you're ready on Senate Bill 430. You'll have to run this one just a minute. I'll be like really brief.
Whatever.
Cam.
Here we go.
I usually just put a line here,
Yeah, okay.
you know, just so that you and I know what,
Yeah.
what the notation
Or
is.
here, you can use this too if you want to. Sometimes I do that.
Okay.
That's even
Yeah.
more clear.
I'll let you highlight them if you want.
All right. Well, I'll be very brief introducing it, so.
Well, and then you'll be right back.
I will.
Looks like we're coming down, so we'll call the hearing to order and recognize the prime sponsor of Senate Bill 430.
Thank you very much, Senator Gray. Good morning. For the record, Jeff Bradley, Senate District 3. I'm here on behalf of the Department of Health and Human Services. This is their bill, and they get the opportunity to speak about every section of the bill except for a couple that I, on my own, put in. And so I'll talk briefly about them. On the first page of the bill, Section 3, Development of a Pilot Program. As you recall, last year I filed a bill for the department that would have allowed people that are over 18 up to 21 to get services that are developmentally disabled. There was a lot of controversy to that. There was a lot of support for it, and there was folks from the area agencies that had some very legitimate questions as to how it was going to be implemented. So I took it upon myself to try to bridge the gap. I think what we had left it in the bill that passed last year was we expected a plan to come back with recommendations for future legislation. There was no consensus. As everybody knows, I kind of like consensus. And so this is my effort to achieve consensus through a pilot program of up to 20 eligible individuals so that we can have a better idea of costs, how many people are going to potentially be enrolled, and we can make the kind of budgetary decisions that would be necessary to move forward. I would like to think that people can get behind this as a way to bridge that gap between the differing positions. And the other provision that I added to Senate Bill 430 is on the last page of the bill on page 22, out-of-state physicians. This allows telemedicine to be covered when there are consultation services or follow-up care via telemedicine from a physician who is not in New Hampshire, provided that person is licensed. I'm told that there will be some folks that will ask for that to be expanded to other licensed healthcare professionals. That seems to make sense for me. This was brought to my attention by a former colleague of ours, Steve Schmidt, who was a representative from Wolfboro that had to travel, I believe it was to Connecticut, when a telemedicine consultation would have been very sufficient to have addressed the needs that he had. So that's where provision 76 comes from. I'm not going to touch on any of the other provisions. It's the department's bill, and Senator Gray, I'd ask you to let them come right up, except I would say that they have also asked me to introduce two amendments, which there should hopefully be amendments for the public, 200 and 196. I'll let them explain both amendments.
All right, but we need to give the other committee members a shot at you if they'd like to take it. So are there any questions from the senators? Senator Whitley.
Well, I will, so thank you, Senator, and thank you, Senator Bradley, for taking my question. So, there's a lot in here. And so, regardless of what we do with it, are there any concerns that the House will have problems with an omnibus bill like this? I know they made a lot of noise about it last year.
This is, like my bill last year, it's not an omnibus bill. It has many different sections based on many different provisions of law, but it's not an omnibus bill. We did not, unlike last year, combine different LSR requests into omnibus packages. So they actually passed much of, maybe somebody here can remember the bill number. I think it might have been 162. And there was, a few things that got changed, but as I recall, they passed virtually all of it.
Thanks, Senator. And with that, we will call up the department.
Senator Bradley, good morning, and members of the Senate Health and Human Services Committee. For the record, my name is John Williams. I'm the Director of Legislative Affairs for the Department of Health and Human Services, and with me.
Hello, my name is Melissa St. Cyr. I'm the Chief Legal Officer for the Department of Health and Human Services.
And we are obviously here in support of the department requested legislation. We want to thank the committee and Senator Bradley. As he had mentioned last year, we were very successful with the department requested bill, Senate Bill 162, that 33 of the 34 initiatives actually ended up passing. So thank you again for that support last year. We look forward to your support this year. For your ease, because of the fact we're trying to keep time well used, we have for your consideration, it's a document that provides an overview grouping by sections of a snapshot of what each respective one does, as well as a quick snapshot on the fiscal implications of the bill. If you see the bill that's been passed around, you'll see that it indicates on the back, because it's just outdated by 1 day, that the fiscal note worksheet was still being worked on by the Legislative Budget Assistance Office. So for those viewing members and people and individuals in the gallery, if you go to the website and pull up Senate Bill 430 now, it actually does have the fiscal analysis done on the bill, and miraculously it looks very much like the document that I'm working off of here today. So with that said, we're going to start off on sections 1 and 2 of the bill that are intended to assist our opioid treatment program. Currently, we administer programs with providers in the community and provide oversight and support. Those particular providers pay a fee for administration of $8 per individual served on an annual basis. And what we're hoping to do here is to create a dedicated non-lapsing account, both in the underlying statute that is the enabling legislation for our oversight of those programs, as well as a corresponding reciprocal account in the Treasury, which is reflected in Section 2. So, Senator Bradley, I can entertain questions between each items. We do have subject matter experts in the lobby ready to come, and we have one, Henry Lopman, very important subject matter expert, actually physically in the room.
I think it'd be best to go briefly through the sections and open it up to questions while each individual witness is here. So I don't see any questions on that section. Plow on.
Senator Bradley, that takes us to Section 3 of the bill. And you may recall that in last year's Senate Bill 162, the department was charged with a plan to address this particular issue. So for economy of time, I'm going to turn this over to Attorney Melissa St. Cyr.
Thank you. As for the pilot program, we met with stakeholders around the individuals that need developmental disability services from aged 18 to 21, that there was a gap in services that was identified for those individuals because they may still be in school but may also need developmental services, and there was no category for those individuals to receive developmental services if they were still in school. So that's what this pilot program does. It identifies those individuals aged 18 to 21 who may need developmental services. And that's, I know that Senator Bradley has already addressed the pilot program portion of it.
Go ahead.
Senator Bradley, just to bring the committee's attention, I'll flag certain areas where we're intending to work with the committee as well as stakeholders on any tweaks. We did receive a request from the Disabilities Rights Center to look at a proposed amendment to this section, knowing that there is a little bit of time to working on some of the tweaking here. We'll certainly group those together. So Attorney Rosenberg will certainly be here to address that on her time. That takes us to section 4 of the bill. I'm looking specifically at Senator Gray. He's been kind enough to be our sponsor 2 times in a row. We're hoping that third time will be the charm. And this deals with agency error as it relates to collection of public assistance. So Senator Gray, if you would like to even give the high-level quick briefing, it is a good productive item. We have Meredith Toulouse in the lobby if you'd like to hear more on it, but it's one that would be very beneficial to the agency, and there's a threshold that does protect for around under current statute of $500, so that we would only obviously use this tool for those larger cases where we need to recover on public assistance. Taking us now to section 5 and 6 of the bill. This is part of the department's efforts to go through reporting requirements that are either outdated or they're duplicating other reporting requirements. And so if you bring your attention to section 5 of the bill, you'll see that it repeals number 1. And I was looking for Senator Sherman, who's not here. But on section 5 of the bill, it would seek the repeal of RSA 126A 4 lowercase a relative to the healthcare plan report. The reason why this is no longer necessary is that the state health assessment and the state health improvement plan already covers for this and actually has a more larger scope. So therefore, our request would be to repeal that current duplicate report. The next one that involves the quarterly reports on Medicaid rate increases. This is one where we were required under the budget back in 2019 to report on the particular quarterly rate increases. We've already made that report, but there's an anomaly in the legislation that requires us to continue giving an annual report on this, so we're just seeking to strike that as well. Section 6 of the bill dealing with the Medicaid Family Planning Services. Again, this is a report, and you'll see down on line 21 of the bill, we're just trying to strike the word "and annually thereafter" because we have accommodated for this. We don't want to touch any of the remainder of that section, but just the annual reporting requirement has been requested by Director Tilley at the Division of Public Health Services. Taking us to section 7 of the bill, at this point, I would call on Rebecca Ross, Attorney Rebecca Ross, although I should refer to her as director now with our Children's Behavioral Health Bureau, but she can walk us through very timely because she assisted in the compilation of these sections during her tenure when she was general counsel for DCYF. And I promise Rebecca.
Rebecca, how are you?
Good morning.
Mark, maybe we can get the next witnesses from the department in here. Go ahead, Rebecca. Thank you.
Thank you, Mr. Chair, members of the committee. Again, for the record, I'm Rebecca Ross. I am the new director of the Bureau for Children's Behavioral Health, and I'm stepping in today in my former capacity as legislative liaison for DCYF. So I assume we are starting with the section related to service in child protection cases. The purpose of this is to modernize the service provision for abuse and neglect cases when a parent cannot be located. It streamlines the process to put it in alignment with the guardianship statute that allows the court to determine the appropriate form of service when a parent cannot be located. We've worked with the court on this. We're likely going to have a bit of an amendment to also make it more in alignment with the termination of parental rights statute that also requires, if it's service, that it's publication 2 weeks in a row, or that if it's service by certified mail, that it's at the last known address. So those are some minor tweaks to put it in alignment with certification of service in other cases. The second portion of it is trying to minimize the duplication of efforts in that if a case starts out as abuse and neglect and moves on to termination of parental rights, New Hampshire chooses to have two separate docket numbers. They used to be in two separate courts. Now they're in a single court. And so they would really allow giving the best notice to parents at the very beginning of the case of the potential consequences of the case. So that would be to streamline the service process for kids in abuse and neglect cases. The next section of the bill that DCYF has relates to creating a separate category of foster care license for kinship homes. This,
And that begins on section 9 of the bill on page 4.
thanks, Don. This particular section is an effort to increase the number of relative placements who are licensed and streamline the process for licensing. Currently, if an individual is licensed, they're licensed for a very broad category of up to 6 youth. There are a lot of family and kin who would like to be licensed, but only for the specific child that is in need of a placement. This would tailor the process to them to encourage that licensing and make them eligible for the reimbursement through the licensing process. And the next section is cleaning up the adoption statute to match the termination of parental rights statute to allow for the department to have guardianship when someone has surrendered their parental rights. This is in the interim prior to adoption to make sure that the child is not left without any full legal guardian who can act in the place of a parent prior to adoption.
And just draw your attention that is section 16 of the bill. We actually are taking them slightly out of order only because the analysis has them out of order.
Which is on page 5.
I think that's the end of my sections unless. I apologize. Section 15 also, can I just
Top of page 5.
at the top of page 5, this looks at, I apologize, this was not in order for me.
So this is in response to a recent New Hampshire Supreme Court decision that Attorney Ross brought to my attention that needed to get clarification. So the court is directing this particular section. So they're specifically looking for an amendment to RSA 169C4 Roman 3. Specifically, the court did direct this as part of their opinion. And you'll see as to the notes that you have in front of you, there's actually a link to the actual court decision directing that legislation.
I think, yep, John covered that one. Thank you.
Thank you.
And Senator
Senator Whitley, sorry.
Director Ross, would you speak to 40 while you're up here also?
Can you give us a page just for?
Let's see. Page 12. 40. Okay.
So, thank you very much for that question, Senator Whitley. We actually have Attorney Melissa St. Cyr, who is going to actually address that. We had planned for her to cover that, and she can respond to any questions that you have as it relates to that question on Section 40 when we get to it.
So, well, I guess my question to Director Ross is sort of how this fits in, adding, so, I mean, yeah, maybe. Okay, so my understanding, so this is for 8 new positions for inpatient treatment. So my guess is that it's related to the purchase of Hampstead. So 2 questions are, I had thought that the department was going to be working with a contractor to provide it, so wasn't sure why these positions were added. And then just thinking through about how this is going to, like, what are the qualifications for these people? That's not in here. And sort of how it fits into the overall system of care, which Director Ross can speak to. So qualifications, contractor, and then system of care. Those are my questions.
Thank you for those questions. So this change is specific to staff that are going to be playing either a leadership role. So we have a CEO or a chief operating officer that will be working, that will be state employees and won't be part of the contract. So these positions, and we're actually going to be asked that they be amended to 11. These positions are for those staff that will be state employees, not part of the contract, but will be directly linked to Hampstead and in charge of Hampstead. Some of them may be security, some of them may be compliance, contractual compliance, accreditation compliance, And then obviously your top level leadership, CEO, COO, CFO, those will all be state employees and will not be held by the contractor.
So I think, thanks for that. That makes sense. I think before I would be comfortable with just putting this in here, if we're going to amend it to 11 to get a more clarification about what these people are going to do, and what qualifications are requirement, I think I would be more comfortable if you don't mind fleshing that out a little bit more.
Sure, we absolutely can give you that information.
Awesome, thank you.
Okay. Thank you very much, Director.
Thank you.
And Senator Bradley, that now takes us to section 17 of the bill relative to the department's vision to.
Page 5.
That's on page, starting on section 17, it is on page 5, line 21. And we do have Director Henry Littman from Medicaid and also Jonathan Ballard, who is in the lobby area, to provide commentary around that section. For note, I just wanted to explain that the timing here was to put forward a proposal that dealt with preventative healthcare, which is certainly something that is cost effective in the long range. And the goal here, very clearly, given the effective date, is to allow the department to put in place the policy, however, to address the budgetary concerns as part of the 24-25 budget.
Good morning. For the record, Henry Lopman, Medicaid Director. I think John basically described what we're trying to do is it's to position the state plan to be able to extend certain preventive health services within the Medicaid program. You know, again, I think Dr. Ballard's here probably can explain the clinical justification a little bit better than I can, but I think the direction is to give us the opportunity to be able to make the request in the next budget cycle.
Thank you, committee members. So there's 4 sort of low-hanging preventive health services that would be included in this Medicaid state plan. One would be smoking cessation or nicotine cessation counseling. So the medications are paid for, but not the actual counseling in our fee-for-service program. So this would cover counseling for teenage vaping and that portion of the treatment. The other low-hanging services are transitional care management, which is a service that is a phone call by nurses after someone's hospitalized once they get home, and then a follow-up office visit within a week. It's a bundled service that's currently covered by Medicare. It's been a cost-effective service that keeps people from being readmitted to the hospital. The other low-hanging service would be chronic care management. It's a phone call by nurses once a month to patients who have chronic diseases like diabetes to help them manage it. Another way to keep people out of the hospital. And then the last one is SBIRT, screening, brief intervention, and referral to treatment. This is an evidence-based program that detects, screens early for alcohol use and drug use, primarily among teenagers, and then offers them referrals to treatment early before they develop a substance use disorder. So it picks up on risky behaviors and prevents high cost, high effects on the society. So we learned about these 4 preventive health services and would like to include them in our Medicaid state plan for future years, and there's no budgetary ask with this request today.
Okay, questions? Okay. John, thank you, Dr. Ballard. They can introduce it, it's fine.
Section 18.
Good morning, Mr. Chair, members of the committee. My name is Meredith Tellus. I'm the Director of Program Planning and Integrity at the department. And I will be speaking to sections 18 and 19 of the bill, which start on page 5, line 29. And these 2 sections are parallel sections to remove the requirement to charge premiums to Medicaid members who are eligible under the MEAD or the MODE programs. MEAD is Medicaid for the employed adults with disabilities, and MODE is the program that is Medicaid for older adults with disabilities. And we are requesting the removal of charging premiums because we find it to be a very cost ineffective program. It is returning to the department approximately $120,000 a year. We charge about 180 people, and the premiums average maybe $68 per person, $68 to $70 per person. So it's 120,000 total funds, which is only 60,000 of general funds that the department earns. And meanwhile, I have 4 staff that have to be engaged in this work.
So it's costing more to collect than
it is costing more. To be clear, I would not remove the staff if we removed the function, but I would replace their duties with where we really should be spending our time, which is third-party liability oversight of the managed care organizations. Our managed care organizations, as you know, are worth a lot more to the department. I think we're over a billion at this point, and the managed care organizations are responsible for doing third-party liability on their own members. So where a member has Medicare or a third-party coverage, they need to be cost avoiding Medicaid first, or they need to do pay and chase. And we get reports from them regularly. But so far, we've only had the bandwidth really to do oversight of our 2 incumbents, and we have not yet had the bandwidth to do the oversight of the third managed care entity whose membership is growing, and we want to be able to do that oversight. We also want to be able to do audits of their TPL work. This is worth a lot more to us functionally than MEAD and MODE can ever be. I think these programs could be beneficial in a state with a larger population.
And
but,
would you need a reference in this bill to being able to move them, or you can do that on your
no,
own?
it's the same staff.
Okay.
Thank you.
Senator Sherman.
Super quick, thank you for coming, and it sounds like the potential return on shifting those 4 people could be fiscally much higher than $120,000. Is that correct?
Yes.
Any other questions?
Thank you.
And Senator Bradley, that takes us to section 20 of the bill, and sections 20 starting on page 6, line 10, all the way through section 24, ending on line 16 on the following page, on page 7. As you'll see, starting on line 13, you'll see the insertion of the word "or the department upon motion to the court." That is actually all that's really trying to be done with these various sections here. This comes in the context of when the department is providing medical assistance to a institutionalized spouse in a nursing home long-term care setting, and you have the community spouses that are out there. This just allows us a clear opportunity to provide information to the court. It doesn't provide any additional standing. It just allows us to provide information to the court that could be helpful in their determinations throughout these statutes. So now that I got a really nice nod from one of the attorney on the committee, I think we can take us now to page 7 on section 25 that deals with presumptive eligibility. My understanding is, on further review, Senator Bradley, that we can accomplish these goals without the need for the specific wording in here, and I'll have Director Lopman as well as Associate Commissioner Chris Santinello to respond to that, but we'd be seeking to remove this section from the bill.
Section 25.
Chris has left. So we had anticipated this section as a function of the American Rescue Plan enhanced match for home and community-based services, that we could run a pilot. It was later that we learned from CMS that because there's a time limit on these dollars, that we would have to go for an 1115 waiver to implement this particular component on a pilot basis, because the funding is one-time money. We're suggesting to remove this, but that we would use the money that we intended to be here to as it's described, to receive services in least restrictive settings, when someone who's eligible for a nursing facility based on the clinical, but we're waiting for a financial eligibility. What we have as an alternative is using Older American Acts, Title III, and the Social Service Block Grant, Title 20, entities that we already contract with to provide similar services to keep people who are waiting for the financial eligibility to come through, to keep them in the home environment so that they don't end up being institutionalized unnecessarily while we're just waiting for financial information. This we can do, we believe, without a change in statute, and that's why we're asking now to have it deleted.
Okay.
And Senator Bradley, that takes us to section 26, page 7, starting on line 27, relative to personal care service being provided by family members at a base rate for that of private nursing. And I'll have Henry please addressing that.
So one of the things that has happened during the COVID and public health emergency is that the workforce shortage that has shrunk considerably in home and community-based care, for personal care in particular. The state received an 1135 waiver to be able to allow family members to provide some personal care up to 50% of the unmet private duty nursing component and be paid for it. We have an arrangement through GSIL, that Grant State Independent Living, that to be allowable, they have to be screened and what have you to bring them on. That 1135 waiver will end when the public health emergency ends. Right now, you know, the current public health emergency was extended federally till up to April 16th. It might go one time further given what we're seeing with COVID, but it's going to end, and it's probably going to end sometime during this year. The workforce situation, even though we have money to invest in that through the HCBS plan, won't recover as fast as and there'll be unmet needs. The department's looking at another waiver, what they call a J waiver, and I won't spend a lot of time going into it, to kind of substitute for what we got through the 1135. But if we don't get that, we'll need to do something to help these families that can't get support at home because there just isn't the workforce to do it. And what we'd be asking here for is a general fund appropriation, I believe it's $700,000 that would be allow us a couple-year period to work through what is going to be a crisis in home and community-based personal care without it, honestly.
Go ahead.
Thanks, Henry. And what is there some? You'd mentioned one agency doing oversight. Is that statewide that agency is providing the oversight?
Yes, they're doing what would otherwise be, screening, orienting. It's the requirements that CMS has to, even though you're a family member, in order to get paid for the service, you have to meet certain requirements. And they fulfill that function for the statewide for us.
Okay, keep going.
And Senator Bradley, thank you. And Director Lopman, thank you very much. I'd like to invite up again Attorney Melissa St. Cyr, starting on, we're going to be taking up section 27, starting on line 1, page 8. Line 1, page 8. Oh, actually,
Hello, thank you again. So as for section 27, which begins on page 8, line 1, we are making adjustments to the eligibility standards for Medicaid. Currently, the federal law requires 36 months of a kind of look back period to look at individuals' assets unless a transfer of assets has occurred or a disposition of assets has occurred. Our law, state law, requires 60 months no matter what. And so we're making this change so that if there is an individual who's applying for Medicaid that has not had any kind of disposition of assets, they've been living at home 10 years, have no assets, and renting and on Social Security, and they don't have any complicated or transfer of assets, they don't have a trust, that we could do a look back for 36 months instead of 60 months to allow for that individual to be eligible for Medicaid quicker and the process to be quicker for them. And as you can see, it says to the extent allowable under federal law. So we would be complying obviously with federal law in this situation as well.
And Senator Bradley, that now takes us to section 28 on page 8, and then there's going to be the following sections that are related to the Therapeutic Cannabis Program that go from sections 28 through 32. So we'd like to invite Mr. Michael Holt from the Division of Public Health Services for our department and the manager of not only Therapeutic Cannabis, but also the Prescription Drug Monitoring Program for the department.
Hi, Mike.
Good morning, Mr. Chair, members of the committee. Thank you for the opportunity to testify. Sections 28 and 32 of this bill would modify the criminal background check requirements for the Therapeutic Cannabis Program in two ways. The first part of this bill would remove the criminal background check requirement to be a designated caregiver for the Therapeutic Cannabis Program. This is an administrative burden and cost to the public. Primarily, this past summer and fall, it took up to 6 weeks to schedule a fingerprinting appointment with the Department of Safety and receive the results. The cannabis program has a 15-day statutory deadline to approve those applications, and it was taking up to 6 weeks to get this process through the Department of Safety. Preferred method of getting fingerprints is through an online portal, so there's a technological barrier for some TCP clients. The cost of a background check, state and federal, is $48.25. Background checks are not transferable across purposes, so even if you've gotten one, in the past month, you have to get another one for this program. There are about 600 registered caregivers for approximately 13,000 registered patients. Patients are not required to undergo a criminal background check, and there's no practical reason for a different standard for their caregivers. Most caregivers are a patient's spouse or family member. Most caregivers are caregivers because the patient is too sick or incapacitated, or they lack transportation, like they cannot physically get to a dispensary to pick up cannabis products. It's unclear what practical protections the current felony prohibition to be a caregiver provides. New Hampshire law prohibits any business model associated with for caregivers. Home cultivation is prohibited. Selling cannabis is prohibited. The number of patients for a caregiver is limited to 5. A caregiver cannot charge a patient for the services more than actual cost of the product themselves. And right now, there are fewer than 20 caregivers that have more than one patient on the program. In addition, the proposed statutory change would support the 2019 LBA performance audit and recommendations by reducing the administrative burden for client application process to the Therapeutic Cannabis Program. I forwarded to the committee this morning some public testimony from a person who was unable to be here today. Jennifer Desloges of Plymouth, New Hampshire, applied to be a caregiver for her husband, who was unable to use his registry ID card because he was too ill to travel to a dispensary to purchase cannabis products. It took Jennifer a month to get a fingerprinting appointment and another month for the results to be processed, sent back to us. She received her caregiver card in October, but her husband passed away from his illness in September. He was unable to access the program due to this requirement. You all have a copy of that testimony in your inbox. The second part of this bill modifies the criminal background check requirement for ATC agents. It does not remove the requirement, it modifies the requirement. It would allow a conditional employment option for ATC agents while the criminal background check process is pending. Again, during the summer and fall of this past year, the time to secure a fingerprinting appointment and receive results was about 6 weeks. The ATCs lost viable candidates for employment due to this delay. A conditional employment clause in statute would protect against such delays in the future and allow ATCs to attract and hire qualified candidates from New Hampshire's very tight employment market. This is why we support this bill and are proposing it, and we encourage you to do the same. Thank you.
Questions? So the ATC provision is section 32?
That's correct.
Okay, thank you very much.
And Senator,
John?
thank you. Senator Bradley, that now takes us to page 10, line 5, which is section 33 of the bill. I do have, I believe, someone from Public Health who could speak on it, but it's a fairly straightforward. I'm looking to Senator Sherman as a physician. This involves the lead remediation and protection, And essentially, current law requires 2 venous blood tests, which is administratively burdensome on physicians. I have a big yes over here, and we're just seeking to remove one of those provisions. And with that, unless there's any further questions for Ms. Rogers, who's our legislative liaison for the Division of Public Health Services, that's the totality of what we're trying to do for that section. Yep. Thank you.
All right, John, keep going.
Here we go. So that takes us to section 34, which clarifies the food services licensing exemption for recreation camps. Also, we have Ms. Rogers here on that, but I think I can explain briefly. We're trying to clarify, as you may recall, back in the budget process in 2019, they transferred the functions from environmental services to our agency for overseeing the summer recreation camps, such as the YMCA and whatnot. So there's some technical cleanup, but there's also substantively, there's a provision in there currently in this proposed bill that talks about a 30-day prior and a 30-day after period for which meals might be served to family members. We are working with the wonderful Henry Vehu, who represents, I believe, one of those associations, perhaps the YMCA, and we would look forward to the amendment that he would offer on that particular section of the
He
bill.
has signed up to speak, but maybe he won't have to if you're working with him.
Hi, members of the committee. It's Abby Rogers, Legislative Liaison. We just wanted to say that we have met with Mr. Veyu and his stakeholders, and we would agree to extend the 30-day provision to 45 days for his request.
Great. Okay.
And I'm sorry. So I'd like to invite back up Attorney Melissa St. Cyr.
Yep.
That brings us to section. Absolutely. So this brings us to section 35, which is on page 10, line 20, and that provision and 36 and 37 we'll address right now.
Thank you so much. So as for section 35, the community mental health program, in accordance with our 10-year mental health plan, as well as the increase of delivery systems for mental health, we would like to change community mental health programs to allow for private entities to be providing services as a community mental health program. So that's the initial change that you'll see in section 35. As for sections 36 and 30.
Can I ask a question about that, Mr. Chair?
Yep.
Thank you. So on section 35, that was something that was included in that bill last year that was taken out. So I'm wondering why it was put back in with all the concerns raised.
So during that hearing, we that bill that was addressed was overshadowed by the IEA changes that were in that bill. And so we have not heard very much from the community mental health providers regarding this concern. It was not something that we talked about significantly during that time. And I know that the commissioner had presented it and felt like it was a change that was necessary, but it was removed and the bill did not move forward because of the concerns under IEA, the IEA provisions.
Just to clarify, I'm talking about the relative to the community mental health programs, that was removed in the original bill. The IEA was a sort of separate amendment that I agree was, a complicated issue. But I have heard concerns from community mental health providers, so.
Yeah, they're signed up to testify. But can you just answer the rationale behind this is to increase the number of individuals that can provide mental health services where we have shortages.
That's correct.
In the state.
Yes.
Yeah, and that's why the commissioner wants this.
Yes.
Follow up?
Yep, go ahead.
So certainly, we have people waiting for care, but my understanding is that it's because we have this massive workforce issue. So is there a concern that if we add more entities that we'll just be sort of picking at that workforce rather than actually solving the workforce crisis that's causing that problem?
So I'm certainly not the expert in mental health services. I'm the chief legal officer. So I certainly know that we want to increase the providers that provide mental health services as a department. We certainly can get more information as to your concerns, but that's not something I'm necessarily prepared to testify to right now.
Senator Sherman.
So I share Senator Whitley's concerns. This is something that has come up before. We've killed it fairly quickly because of the issues. I would just ask that we have the opportunity to ask questions of somebody within the department before we act on this.
Of course.
Thanks.
And Senator Bradley, if we could have Attorney St. Cyr remain up here, because I think the two of us can take us home for the remainder of this bill together.
Absolutely.
So that takes us to page 11, line 28, which is section 38 of the bill. And you may recall that over the last 3 or 4 sessions, we've done cleanup to align legal with working titles for unclassified positions. There was a time where, for example, our information systems person was identified as a dentist. And Senator Rosenwald was very instrumental in motivating us to start to clean up the 80 or so positions. So as things evolve, we have an annual need for 1 or 2 or 3, this year just 1. And you'll see that we're trying to substitute the current title of Administrator for Family Strengthenings and Child Well-Being Initiatives to the actual role of what that person does, which is Business Improvement Administrator. So this is a cleanup and something that we've done for a few sessions. Section 39, this involves shift differential pay paid to certain clinical staff. We recently had an LBA financial audit of New Hampshire Hospital and Glencliff Home, and it was identified that there, although well-intended, there was a small stipend that was provided to certain employees for shift differentials, both at New Hampshire Hospital clinical staff and the Glencliff Home. And it was identified as part of this audit that that should not have taken place. What is left here, though, to bringing equity to the matter was that there were certain clinical staff who did not receive the differential pay. So what this bill attempts to do is to provide a $29,000 general fund appropriation, basically to make everyone whole as part of that process. But moving forward, we will certainly make sure that we only provide shift differential pays based upon law and regulation. That takes us to page 12, section 40, which we addressed before, and unless there's other questions, I believe we can go to 41. So the next one, the cost, okay, so section 41 on line 15 of page 12. What this attempts to do, and it's very well reasoned, under current law for New Hampshire Hospital, we can recruit and provide certain costs for unclassified positions, physicians, pharmacists, to recruit them, and if they're coming from out of the state, to offset some of their costs to moving here. And it was identified as part of the workforce issue to getting good people working for New Hampshire Hospital and for Glencliff Home, that we need to do the same for certain clinical staff and others that are classified positions with the state. So what this attempts to do is to bring the same authority that is for unclassified to classified positions. We do intend to bring some tweaking around this, Senator Bradley, and we certainly would engage you in the committee on those changes, because we just want to make sure that we have a process that will work for the classified employees. That takes us to section 43 of the bill, and I'm sorry, 42. And so this begins at sections 42, and I get to my cliff notes here. Sections 42 and 64, which is going to get us way through a lot of this bill, is essentially a cleanup to remove Anna Philbrook references as well as to the Laconia State School references that are no longer necessary in statute. So that's the totality of all the changes that have been made in sections, again, 42 through section 64 of the bill. So unless there's questions, and certainly take your time, there's a lot of reading that has to be done. It took one of our attorneys, Maria Reineman, a considerable amount of time to go through thoughtfully all of this. So if there's any questions from the committee members, we certainly can address it, but it is cleanup in nature. And that takes us to section 64, 65. Thank you.
As for section 65, the current process for criminal background checks for those who work in child care agencies, they are responsible for going through a very thorough background check, and then they receive a card, and that card costs $50 for them to have, and then it's good for 5 years. That was a self-sustaining program, and what we recognized over the last few years of its implementation is that $50 is not necessary for us to sustain that program, that those fees can go down. So you will see here that the card itself, the issuance will be only $25, and it's still good for the same 5 years. And then it prorates it, and then also a replacement card, the fee for that has gone down as well. As for section 66, the same, that's the same change. 67 and 68 is truly just a change in verbiage from daycare nursery to infant and toddler program. Daycare nursery is not a term that's used in the industry any longer, and so infant and toddler program is what they utilize, and we're making that change just for cleanup. As for so that is 67 and 68. As for section 69, there's a rework of the definitions around child care agency. Currently, there was a lot of circular, the definitions were rather circular. So in child care agency, it would mention things that were in child care institutions, and it wouldn't be very clear on which one was, which one we were talking about at that moment. There was later on with the homeless youth program that was included under child care agency, and so there was lots of reasons why this needed to be cleaned up. So we did not change the definitions. They still will be licensed and managed in the same way that they are, but it's just made it a lot clearer for the programs on what program you are, and including independent living homes, specialized care homes, homeless youth programs, so they all have their own category and they all understand, which category in which they fall under. As for section 70, that's just the repeal for the previous. Section 71 is because child care agency includes child care institution, we just removed child care institution. That's also related to the definition changes above. Section 72, it is the same change, removing child care institution as it is incorporated as a child care agency. Section 73, we recently received responsibility to license recreation camps, and that was only in the last couple of years. There's been lots of questions around whether or not certain programs, including a preschool program, was a recreational camp or was it a preschool program? And so we wanted to make sure that some of those overlapping, especially in the summertime, but there are even camps that happen in the winter over breaks and things like that where people were questioning whether or not it was a child care program or was it a recreational camp. So this change is just making that clear that preschool programs are not part of recreational camps. And if you just give me one moment. Under recreational camp licensing, there was also some concerns around confidentiality. They were not afforded in the statute originally when they were overseen by the Department of Environmental Services. They were not provided the same confidentiality requirements that child care agencies were allowed to. So we included confidentiality provisions in investigations as a new section in this statute. Because so that it would mirror what child care agencies have for confidentiality protections.
And Senator Bradley, that pretty much takes us to page 22, line 11, which is section 76 of the bill. This language was inserted. Certainly the department is supportive of this change, and I just turned it over to you, Senator Bradley, for the background on that section.
I already talked about that. You missed it. Oh. And I ain't doing it again.
Thank you so much, Senator Bradley. So now that brings us to the end of the bill as introduced, Senate Bill 430. We do have two amendments that have been requested. I think the first of which, if we could take up, and if Attorney Ann Edwards from the Attorney General's office is still available, this would be in regards to Amendment 0196S, again, that's 0196S, as it relates to converting the existing attorneys who do the work for the Division for Children, Youth, and Families under Child Protection Act cases from classified positions to unclassified positions, and Ms. Edwards and Attorney Melissa St. Cyr will be available to give some background and to address the committee.
All right, so that's Amendment 196.
Yes.
Right.
And in the interim, while we're waiting for Ms. Edwards, we could certainly bring up Director Lipman.
Good morning.
Good morning.
Thank you very much. Ann Edwards from the Attorney General's Office. So we are here to speak in favor of the amendment that's being proposed to Senate Bill 430. Deanna is the supervisor of the 34 DCYF attorneys, and I work with Deanna as her supervisor because the legislature gave that responsibility to the Attorney General's Office in 2017. Deanna?
So it's actually 33 of us total. There's me, the legal director. We have 3 attorney supervisors. We have 28 attorney twos, and then we have 1 part-time attorney who's actually somebody who retired and then came back to us. So at this point, what we're asking for is what was requested and mentioned in a 2018 report from the Department of Health and Human Services and DOJ, requesting that the attorneys become unclassified positions. And so what we're asking for is to have it sort of tiered in a better way so that there's opportunities for growth for all of the attorneys. And in offices where we have 3 or more attorneys, we would have a sort of mentor middle ground attorney in there. We think that that would be really helpful overall, because part of what we hear from the attorneys is there's really no place for us to go here.
Sorry, Senator. The additional reason we are looking to move the attorneys from classified positions to unclassified positions is that the attorneys have their own ethical responsibilities. Under the rules of professional conduct for attorneys, we have to be prepared as we feel is necessary in a case. The challenge that we have right now is the DCYF attorneys spend many of their days, and when they're in court, it's most of the day in court on these cases. What we often hear from the attorneys is that they don't have the time to fully prepare. They want to be able to do things on Sunday nights or on Saturday mornings, and they want to do things sometimes later in the evening after their work hours. We do allow that. We have to give permission. They have to receive permission from their supervisors to get that additional time. The challenge is it's a budgetary issue, and it's also an issue with comp time as well, because the attorneys are already struggling to take all the time off that they need to take off. And so if they build up a bank of comp time, it becomes a challenge because we do require them to take it so that we don't end up having a budgetary issue. And what moving them to unclassified would do is, as part of the Korn Ferry study, it would be taken into consideration the amount of comp time that they currently use in determining what their final salary would be. So they would be compensated fairly for the work, but it would allow them the flexibility under their own professional responsibility to be able to do what they think they need to do to complete their cases and be ready for court and to be ready for witness prep and things like that. So as a result, we believe that moving the attorneys to unclassified positions will help in that. We have had some conversations with the attorneys regarding this. We know that there are people that are very much in favor of it. We know that there are people that have a fair amount of questions, so we need to provide information on that as well.
All right, so what I would suggest, obviously we're not going to take this bill up for a while. Just make sure you've done as much homework as possible with the attorneys so that there's the greatest amount of buy-in. I think it makes sense to do this as it's been described to me, and perhaps I'm wrong. This will enhance their career opportunities and in many cases actually lead to a higher level of pay as opposed to the comp time that they have to take. And it, if I recall correctly, I was told that the attorneys are at a 37.5-hour work week. So it actually would help resolve, because presumably on a salaried basis, they could work a little bit longer. Some of the staffing issues at DCYF, obviously you have very committed people there, and thank you for that. So it seems to make sense to me. We don't want a food fight over here, though.
We understand, Senator.
Senator Sherman.
Quick question, is this important for recruitment and retention of attorneys? In other words, will this make the positions overall more attractive? Because in DCYF, as you know, mostly on the clinical side, we've had a lot of trouble getting enough people.
And on the legal end as well, currently I have 3 openings. I'm actually really lucky that I'm going to be able to fill those positions very soon. But I think part of the issue is certainly salary that we offer. And then we also have had staff that work with us that leave because they don't have the opportunity for growth.
Okay, great. Thank you.
Very much.
Thank you, John. All right, one more amendment.
You didn't offer a market.
Art pay grade?
And finally, the sentencing settlement under amendment 0200S.
Good afternoon again, good morning again. For the record, Henry Lopman, Medicaid Director. Yes. So I think, as you know, under New Hampshire statutes, the settlement monies go to the general fund, and the legislature gets to decide what to do with it. This amendment, what we're trying to do here is that the damages, if you will, that led to the settlement are a function of what was going on in our state fiscal year 20 contract with the MCOs, and we have what we call a risk corridor calculation that basically made sure that during the pandemic at the time that there wasn't, due to lower utilization, excess profits taken, if you will. And so we have a certain obligation back to CMS as a part of, to the federal government as a part of that. And all we're trying to do is, if we don't, if the money, this 2.4 million that's described here doesn't come to the department, we won't have the funds to pay back the federal government, other than, taking them from some other source that wasn't planned for. So this money is attributable to the settlement, but specifically the amount that's specifically in the bill, the 2.4 million, is to have the funds necessary to complete the risk corridor calculation, and that's what we just wanted to make sure that we didn't have to come up with other funds within the department to accomplish that.
Okay.
Just one
Yes,
question.
Senator Whitley.
Thank you. So thank you for that explanation. Is the department going to be providing the committee sort of a tiered list of what they would like to use the settlement funds for?
So
I know this is just related to one particular issue, but it would be nice to know sort of in the context of what the other needs are.
So other than the $2.4 million, this money will not be coming back to the department. So it's going into the general fund. So we will not be utilizing any of the other funds. We need the 2.4 to be able to pay back the federal government their federal share, and to put back into the Medicaid program the $1.2 million that is the state share. But otherwise, the remainder of the money will not be coming to the department.
Follow up?
Yep.
Could you put together a list of tiered requests that this money could be used for the department, or for the the different programs within the department? Considering that this is coming from the managed care program.
Yes, I mean, I think we can do that, but I think it's in your discretion as a legislature in terms of what we do. I suspect you will probably see some things come through various bills and
Yeah,
to
I
that
think
extent.
Senator Rosenwald has a,
Yes.
for the dental benefit. Okay, seeing no more questions.
Thank you.
Very good. All right, so I'm gonna call on Greg Moore since he's sitting right here. And Grant, if you could look for Heidi Kroll or Henry Bayou in the outer room.
Thank you, Mr. Chairman, members of the committee. I appreciate the opportunity to speak here today. Obviously, this is a challenging bill. It's kind of trying to stuff 20 pounds into a 5-pound bag, so that's always always going to be a tough lift. If I wanted to talk about every single component here, I could be here for an hour, but neither you nor I have that. I'm going to focus my energies on 3 specific areas. One is just a pure cleanup drafting error, apparently, but I'd like to focus on Section 17, which is page 5, line 21, relative to preventive care services in the Medicaid state plan. As Von Clausewitz once said, you prepare for your enemy's capabilities, not their intentions. And what this statute, if put in the statutes, did would be an open-ended opportunity to add or remove optional benefits from the Medicaid state plan without any legislative oversight. So what I would do with that statute is either specifically list the 4 items and leave it at that, or at a secondary basis, I would, if you want to keep it open-ended as it is, I would put in approval of the HHS oversight and the fiscal committee. One or the other is, I think, an appropriate strategy, but I think you absolutely want to do one of the 2. Secondarily, Section 27, relative to the look-back period. I was instrumentally involved in 2005 on House Bill 691 for the former House members, and I know there are a few House members on this committee. To put in perspective, the HHS committee had 8 subcommittee hearings on this particular section, and it was very intentional about the movement from 36 to 60 months. And I will tell you that the work that was taken from that byproduct of the legislature in that legislation, which is House Bill 691 from 2005, ended up being grabbed by Senator Gregg and put in a Deficit Reduction Act of 2005. So that's how it ended up getting into federal law.
I remember that.
Instead of going from 60 back to 36 months, I'd recommend creating a system where you keep it at 60 months, but allowing the department to have a process, probably through 541A, to reduce that from 60 to 36 months. I think that it reduces the opportunity to see the type of abuses that we identified during the development of that legislation. And so I think that's a better strategy to try to accomplish the goal of what the department's trying to get to here without potentially opening the door for some of the abuses we saw and identified 17 years ago now. What's that? So this is top of page 8, section 27.
Senator Sherman has a question.
Just before you go on,
Sure.
I shared that concern that you're expressing. Would you use a process, or would there be triggers that we could put in statute that would allow somebody, I mean, in other words, conditions that might be in statute that would allow them to shorten it?
So, Senator, it's a great question. I'm of 2 minds of this. So I used to work at the department, and I also used to work in the legislature. So sometimes I like the idea of putting things in statute, and sometimes I like to put them in administrative rules. Given that there's the potential for change, and as you know, the legislative process is a lot slower than the rulemaking process, my gut would be to put it in the 541A and have it run through jail car. That would just be my thought. And obviously, the legislature still has oversight over the administrative rule process. And then just the last item I would mention is a very page 12, line 6. I think you have an extra 0 in there. I think the intent was to appropriate $29,000, not $290,000.
Where are you, Greg?
So this is page 12, line 6. Very, very simple cleanup, and that's the entirety of my testimony. I'd be happy to take any questions.
Okay, so I'd ask you to work with the department on that because that is something I was concerned about too, because I actually voted on that budget reconciliation in Congress.
Thank you.
Okay, Henry Vayu, do you want to testify? I understand that the department's working with you on an amendment.
Yes, and just for the record, my name is Henry Vayu, and I'm here on behalf of the New Hampshire Alliance of YMCA's. They have summer camps, and the section that I've been talking to the department with, and I spoke with Colleen Smith from the Food Protection Bureau. Yesterday, she's all set with it. I think the department mentioned changing 35 days to 45 days is what we're looking to do. It addresses the shoulder season before and after the camp season. So before the kids come in and after, the camps, the Y camps typically staff up around mid-May. And they have sometimes boys and girls clubs, church groups, school groups that come in for a few days, and it's the food service then. And so just going from 30 days, camp usually starts the end of June. So if we go 45 days, then we're talking about mid-May, which is in sync with when the shoulder season is for a lot of the Y camps. And the department was fine with that. So it's a very simple amendment, just changing it from 30 to 45 days.
Okay, thank you, Henry. You'll let me know if you've worked out that amendment. Let's go to either Lisa Madden or Jim Monahan from the Community Mental Health Centers. Or since Nancy Vaughn is sitting here, we're going to go to Nancy Vaughn.
Thank you, and good morning. I believe it's still morning. Senator Bradley, members of the committee. For the record, I'm Nancy Vaughn, Government Relations Director for the American Heart Association here in New Hampshire. And we are very happy to be here today testifying in support of Senate Bill 430. In particular, we're offering comments in support of Section 17, which is the Preventive Health Care Benefits. One of the leading causes of preventable diseases and death, including heart disease and stroke, is the use of tobacco. And cigarette smoking accounts for 1 in 4 cardiovascular-related deaths every year. While we've seen smoking rates decline in New Hampshire, we still have almost 14% of adults continuing to smoke. And within the Medicaid population, the rate is twice that of the general population. And most adult smokers began using tobacco while they were in their teens. And most, about 2/3 of them become regular smokers by the age of 19. So we don't want this to be made into a personal responsibility issue. It really is something that we need to provide services for those people who get addicted to these products at an early age. Tobacco use is an economic drain. It contributes to poor health and higher healthcare costs. And the cost to people in New Hampshire is upwards to $869 million a year in healthcare expenses, and 166 million of that is covered by the New Hampshire Medicaid program. So reducing tobacco use amongst this population will help reduce costs. We actually see in states that have offered these full benefits to those who want to quit smoking, a $3.07 return on investment for every $1 invested in tobacco cessation. And it's important because 68% of people who use tobacco report they want to quit entirely. So I just want to close by saying, tobacco cessation treatments remain highly cost effective. It's very difficult to quit an addictive habit like tobacco use. And having comprehensive cessation services is very important. A combination of counseling and pharmacotherapy is required to be part of this program. So with that, I will conclude my comments. I do have written testimony with some fact sheets attached in case you want to know all there is to know about tobacco cessation benefits. Thank you very much.
Okay, seeing no questions, thank you very much. Now we'll go to Lisa Madden and Jim Monahan. And Grant, next would be Karen Rosenberg of the DRC.
Good morning, and thank you for letting me join you this morning. My name is Lisa Madden. I am the President and CEO of Riverbend Community Mental Health Center and the Vice President for Behavioral Health for Concord Hospital. I'm here today to speak in opposition of Section 35 of Senate Bill 430. The same language that appeared in Section 35 of this bill did come before you, or come before everyone last year in House Bill 565 as part of a non-germane amendment on conditional discharges from New Hampshire Hospital and other designated receiving facilities. On behalf of the New Hampshire Community Behavioral Health Association and the 10 community mental health centers, I testified against this language of that law, and House Bill 565 was killed by the Senate at that time. The current definition in HEM 403 defines a community mental health program as a mental health program operated by the state or city, county, or nonprofit corporation and approved pursuant to HEM 403 for the purposes of planning, establishing, and administering an array of mental health services. When RSA 135:C, relevant administrator roles, and community mental health center contracts are reviewed, you can see an intentional plan for regionally based nonprofit providers to provide a broad spectrum of services to individuals deemed eligible per state regulations. Some of these required services are reimbursable by third-party payers, and some are not. All services require considerable administrative documentation and reporting. Peeling off services that are more likely to generate adequate payments for private and private for-profit entities will erode the ability of existing community mental health centers to provide a network to maintain financial integrity. Although it's not intended, this will result in the fragmentation of care for clients and could actually weaken the system of care in New Hampshire. As nonprofit entities, designated CMHCs do not seek to generate profits to give back to investors or shareholders. We reinvest in workforce and services to further the mission of the organization and improve our ability to meet clinical needs. Focusing on attracting, retaining an adequate workforce for community-based care and adequate and sustained funding will absolutely result in the improved access to care and therefore the reduction in the boarding in the emergency department. In fact, in the past 15 months, I'm going to give you just a snapshot of what Riverbend has done to reinvest in our staff. We have invested over $2.6 million in our employees, a little over $1 million in one-time bonuses funded by the Maintenance of Effort Forgiveness from Managed Care, $900,000 to strengthen base salaries. This is money that we hope we can continue to sustain versus our bonus structure that we knew that we could not if we didn't get renewed funding. $97,000 in recruitment efforts, $100,000 in sign-on bonuses, and $490,000 in increased health insurance costs to hold the employee harmless for any of the increased expense. All of this was given back to the employees in an effort to build our sustainability and to be able to retain our staff. Riverbend, like all of the community mental health centers in the state, is investing in all possible resources to rebuild workforce. We are asking the state to shift the focus from adding more organizations to appropriately funding those who are doing this work daily. If we find ways to continue to invest in sustained workforce, we will quickly improve the access to services, which is what I can see and understand is what the real issue is at hand. So consider the following. In December 2019, CBHA reports there were 200 staff openings in the aggregate for all community mental health centers. 175 of these openings were for clinical or direct care services. 2 years later, in December of 2021, CBHA reports there are 383 staff openings, with 328 being for clinical or direct service providers. This represents a 54% and 53% increase, respectively. Offering select contracts to private providers, many who may be from out of state, does not assure an increase in available workforce and therefore services. They are not bringing 383 professionals with them to New Hampshire. They will hire from within, further jeopardizing our ability to meet the needs of our clients. Community mental health centers are eager to continue to work with DHHS to diversify service, expand access and care coordination, improve housing opportunities, and strengthen community-based reports. For us and for CMHCs, it is our passion, our mission, our purpose. Sustained staffing is key to program development. We respectfully request that rather than peel off resources to add to the bottom line of a for-profit entity, that the focus be on adequately funding the nonprofits existing for nearly 60 years to serve citizens living with mental illness and substance use disorders. We ask that you reject the language proposed in Section 35. Thank you for your time.
Quick question, and since you read your testimony, please leave it with Ann.
You do have it.
Oh, okay, thank you.
Oh, you can, okay.
Senator Sherman.
Thank you, and thank you for taking my questions. Overall, do you see the problem adequate geographic coverage of the 10 CMHCs or difficulty with workforce in terms of being able to provide all the services you want and need to provide to your patients?
I believe it is absolutely related to the workforce. The community mental health system of care is a very thorough, expansive system of care in which we are all invested in providing all the services that we are able to do. The issue is when you can't, I'll speak for Riverbend, we have a 20% vacancy rate right now for clinical positions. When you can't hire based on what some of these unfortunate compensation structures are, then we can't meet those needs that we know how to do, that we are designed to do. We also, as a community mental health center, we are part of a system of care that really represents a strong continuum, where the patient experience is that they can come into a community mental health center and get all the services that they need to be able to be successful in the community and not have it broken up into different parts or different providers. So it is, I believe strongly it is workforce.
One more.
Make it a really long answer. I'm just kidding. So could a for-profit CMHC pick and choose the programming that they offer and be able to offer sort of nominally one part of the programming, but have a robust part of the programming that would actually be more highly profitable?
Yes. I mean, a community mental health center is regulated by federal guidelines, and there needs to be certain elements of care that must be provided within a certified community mental health center. The worry is that you can take parts of that work and not make another entity a certified community mental health center, and they can provide, maybe just the case management or maybe just some community support. And if that, you can't have duplication of services. You don't want to have one patient getting that same type of service from multiple vendors. So then community mental health centers wouldn't be able to follow that full continuum of care, and it would be more fruitful for them. Yes.
Thank you.
Okay. Thank you very much.
Thank you very much.
I don't think you have anything to add, do you? Thank you. On other sections of the bill?
Yes.
Okay. You're up.
Thank you, Mr. Chairman. Jim Monahan with the DuPont Group, and wanted to offer some quick comments on behalf of a number of clients. Section 35, which was just addressed by Lisa Madden, was one of the sections, and so everything she said I agree with, and offer the same testimony on behalf of the other 9 community mental health centers. The next section that I wanted to address was Section 27 on behalf of the New Hampshire Association of Counties. I have a letter. I'll give that to you. It makes reference to Section 25, which, as you know, Henry Lipman just said was unnecessary, but also Section 27 falls into the category of what we're trying to address with this change, which deals with the look back for Medicaid eligibility. There's 2 populations that we're trying to immediately address here. The first is an issue which has arisen with the hospitals and their inability to free up beds during the pandemic. As the committee is probably aware, using ARPA funds, the Department of Health and Human Services has worked with nursing homes, particularly the county nursing homes, to discharge people from the hospitals without a payer. Most of these individuals are folks that are Medicaid pending. And so the county nursing homes have taken about 45 of these folks. Some of them do have their payer issues addressed, but others don't. So this is that population in a very immediate sense is being dealt with ARPA funds. But as Representative Gray knows, the County State Finance Committee began tackling this larger issue of folks that are living in nursing homes and waiting for their Medicaid benefit to be approved or not. And we've heard instances of where people have been residents of county nursing homes for 2 or 3 years waiting for Medicaid to be approved, and during that time the nursing home is not receiving any payment. So in order to address that, we've worked closely with the department to develop a program where, as Melissa St. Cyr identified, set up a system where if there have not been asset transfers, the look back can be 36 months. I want to add a little emphasis to this section because I was a little surprised to see Americans for Prosperity come in and testify against the provision and offer an alternative. I'll certainly talk to Mr. Moore about that, but I think that what we've worked out with the department is an appropriate solution. It doesn't throw away the 5-year look back that was worked on 17 years ago. I'm embarrassed to say I worked with Mr. Moore at the time on that, so I will talk to him about it. But I think this solution is the appropriate one. And then lastly, I wanted to offer some comments in Section 76, which Senator Bradley has already addressed at the several hours ago at the beginning of this hearing. That deals with allowing consultations by medical doctors through telehealth. The Nurse Practitioners Association, a client of ours, and they have identified that as somewhat problematic because it is not just those regulated under 329A physicians that provide these services, others do as well. I spoke with Senator Bradley yesterday. I'm going to attempt to draft some legislation which would capture all providers that provide these consultation services, so that it addresses all of the folks in need of the care and consultation. So, with that, I think they grabbed my testimony, but I can answer any questions. I know you're constrained for time.
Great. Thank you very much. Okay, I believe the last person that we have signed up to speak is Karen Rosenberg of the Disability Rights Coalition. Good afternoon.
Good afternoon, Senator Bradley and members of the committee. First of all, Senator Bradley, thank you so much for inclusion of the pilot program. That's what I'm really here to testify about. It really is it's a nice step in making sure that older students with disabilities have an opportunity to get the services they need. And I really appreciate that there's an appropriation and that there's a time frame for decision making. You may recall that, Senator Bradley, that you and Mike and me had a meeting, and I mentioned that there was a technical issue or two that we were considering, and I just want to fill you in on what that is and the steps we've taken to address it with the department. So specifically, the concern is that we want to make sure that since the department is the ultimate decision maker in terms of eligibility and determining whether a service is the responsibility of the school district or another agency, that we want to make sure that the department has the information it needs to make that determination. And so for that reason, we've talked about a concept with the department that would make sure that the department can get that information and that the school district would need to cooperate with the department. And then the second very small technical issue is that we want to address service planning. Paragraph 2 of Section 3 has a list of the departments that would be part of service planning, but but schools aren't specifically included. And since the Department of Education doesn't have access to school records, we would propose that the LEAs or school districts are specifically added to that section so that we have the right players at the table. And our discussions are ongoing. I have prepared an amendment for your review, which I've also shared with the department, and I'm happy to take any questions about that. Before I do, I just want to put in a plug for, I think that the ACLU had submitted some testimony about sections 36 and 37. This is about the IEA process. There have been some stakeholder meetings about those procedures. I think that we are on a really good path towards resolving them. My understanding is that the department is proposing that they be removed from now, and we would support that. So, any questions?
Senator Whitley.
Thank you, Mr. Chair, and welcome to the State House, Attorney Rosenberg. It's good to see my former colleague. And I also just want to take the opportunity to congratulate another former colleague on his impending retirement. Mike Skibby will be leaving us, so I just wanted to congratulate him and thank him for all his service. Thanks. All right, no further questions.
Okay.
Thank you.
All right, I was handed a last sheet on Senate Bill 430. Susan Stearns, I believe, representing NAMI. How are you?
I'm well, thank you.
Good.
Good morning, good afternoon. Chairman Bradley, members of the committee. I'm here on behalf of NAMI New Hampshire, where I am the executive director. I'm a resident of Samberton. NAMI New Hampshire is overall supportive of much of this, but we're not taking positions on all sections. Section 37, the concept, NAMI New Hampshire is supportive of. However, we do believe that it could be worded differently so that it would say, instead of a court located in each district in which a person may be admitted, that it could just be that the court shall offer probable cause hearings Monday through Friday, excluding holidays. We would like to see that this is making it very clear that regardless of where you are and whether there's a court that traditionally offers those hearings, you will be afforded your due process rights. Similarly, Section 37 goes on to add that a medical practitioner will be added to the list of individuals who can request a continuance. We are opposed to that piece, just in the concept that it should only be for a medical reason, and our concern is that it may be used because someone is in an emergency department and still awaiting disposition. And that would be our concern, that someone's due process rights could be voided without it being a medical reason. We'd be happy to look at other language that might fix that, but that is a concern that we have. Other than that, I don't have anything else to say on the bill. And I know you've had a very long morning, because I've been watching you.
Just a quick question.
Yep.
Yeah, thank you, Mr. Chair, and congratulations also on your new position.
Thank you.
So just wanted to make sure you're looped in with the stakeholder group that is working on those sections and making sure that you're connecting with them about this.
Yes,
Okay,
yes,
great.
we are.
Thank
And
you.
I apologize, our public policy director would have been here today, but a personal situation arose, so
Thank you.
I'm here to cover for her.
Okay.
And I do have copies of her testimony.
I don't think I have anybody else who signed up to testify. John and Melissa, I think you've hung in there, worked with all of the various entities and those of us on the committee that are concerned about the specific sections of the bill and report back as you can. All right, remember this is an FN with an appropriation, so we have to do due diligence quickly. Okay? All right, having said that, we'll close the hearing on Senate Bill 430. Give me 1 second to organize my papers. We will open the hearing. Oh, God. Okay, we're gonna open the hearing on Senate Bill 446. Before I recognize Senator Whitley, there is nobody signed up to speak in opposition to the bill. So I'm gonna ask Senator Whitley, you ask all the participants to no more than 2 minutes. I have a hard stop of 12:30 because of the Commerce Committee. Senator Gray will take over for this in the last hearing, but if you please could accommodate that since there is no opposition. Okay, go ahead.
Great. Thank you, Mr. Chair, and I guess it's almost good afternoon, members of the committee. For the record, my name is Becky Whitley, and I'm honored to serve New Hampshire District 15. So today, I'm very honored to bring forth Senate Bill 446. This is a bipartisan bill establishing a child care workforce fund to provide grants to eligible child care programs for child care, workforce recruitment and retention bonuses and benefits. This bill is necessary to support an incredibly important part of New Hampshire's economy, our child care workforce, the workforce behind the Granite State workforce. When child care businesses can't recruit or retain employees, we know that classrooms and programs close down. Fewer child care spaces are available for the children of New Hampshire workforce, resulting in employees having to resign or turn down job offers across all industries. This has a ripple effect across our entire economy. We also know that child care programs offer a supportive environment for healthy child development and prepare children for success in school and in life. But they also allow parents to get back into and remain in the workforce. The pandemic illustrated just how essential childcare is to our economy when all of a sudden no one had it anymore. When childcare centers and providers had to shutter and schools were closed last spring, it became immediately apparent how important childcare is to a robust economy. But unfortunately, the pandemic also exposed the fragility of the New Hampshire childcare system and the need to solidify this workforce. We know that the future of our state depends on it being an attractive place to live, work, and raise a family. When New Hampshire children and families thrive, New Hampshire's workforce and economy prosper. Building a more sustainable childcare infrastructure and creating policies that support caregivers to both work and care for their family members are critical for Granite State families and central to rebuilding and sustaining our economy. I want to provide some startling data that in support of this bill. In May 2021, the director of the New Hampshire Economic and Labor Market Information Bureau reported that increasing the labor force participation rate of women 25 to 54 by just 1.3%, that's 10,000, through increased access to childcare would add over $1 billion to New Hampshire's gross domestic product by 2031 and over $1.5 billion in personal income. Also in May 2020, the Bipartisan Legislative Advisory Board of Governors Office for Emergency Relief and Recovery stated, as we begin reopening our economy, the biggest impediment to getting people back to work is access to safe, reliable, and affordable childcare. Addressing the current childcare workforce shortage is key to New Hampshire's economic recovery from the pandemic and will provide critical infrastructure for parents to work or pursue training or education while their child is in an affordable, safe, nurturing, and educationally enriching environment. Look, we know that low wages, job instability, stressful working conditions have resulted in 80% of centers across the country claiming staffing shortages. That's startling. In our own state, as of December 15th, 2021, New Hampshire had 1,500 unfilled childcare positions. That has meant that 54,000 children under 6 years old in the Granite State needed childcare, but there were only 33,000 licensed slots. So, SB 446 makes an appropriation of $8.9 million to the fund for the purpose of establishing and administering the grant program. Folks behind me will go through the appropriation cost analysis that brought us to $8.9 million. This fund is non-lapsing and continually appropriated to the Department of Health and Human Services for the purposes of this section. It's important to note that it remains very likely that there will be bipartisan federal investment and structural changes to the child care system. But this bill is necessary as a bridge and complement to that investment should it come. This bill is personal for me because I'm a working parent with a young child at home. I care deeply in public service, but I will always put my family first. I deeply understand the challenges facing Granite State families and have come together in a bipartisan way to work towards solutions. So I look forward to working with my colleagues to get folks back to work and move our economy forward because kids and jobs are nonpartisan issues. I thank you for your consideration. I do want to mention an amendment that we have put together. Amendment 0276. So the issue was raised to me that instead of having one entity manage this fund, that perhaps we should instead, contemplate utilizing an emerging regional infrastructure. So we have talked a lot about the preschool development grant in this committee. There was money used from preschool development grant to start building this regional childcare infrastructure. So this amendment just makes that clear that we should think about using this regional structure in administering these grants. So there are plenty of very smart people behind me that can talk to how we arrived at this appropriation, but I'm happy to take any questions from the committee.
So I just have one question.
Sure.
Obviously, this is an off-budget year. You have appropriation of $8.95 million with the possibility of using discretionary ARPA funds.
Correct.
Would you be amenable to, in an off-budget year, especially with the Sununu settlement legislation that we're gonna have to deal with, that it's tagged at $100 million right now, which is the surplus that we're running right now, a restriction on only using for fiscal 23 ARPA funds so that this initiative could be considered for general funds in the next budget.
Yes, that would be fine.
Okay, well, thank you. Okay, seeing no further questions.
And if you're interested in the fiscal analysis, either Representative Mary Jane Wallner or Jackie Cowell could go through that analysis.
Ms. Hebert.
Good morning. I think it's
Afternoon,
afternoon.
right now.
Okay. Thank you. My name is Karen Hebert, for the record, from the Department of Health and Human Services, Division of Economic and Housing Stability, and I'm happy to introduce with me today
Rebecca Lorden, Finance Director for Human Services.
So I first want to start off by stating that the department does not take a position on the bill. Certainly support the concept of higher wages for childcare workers, but I do want to point out a couple of things. Reading the language in the bill, the department certainly understands that it would not be responsible for managing the financial investment and the fund, except for that which is appropriated to the fund for the purposes described in the new paragraphs 2, 3, and 4 for the proposed statute. That 10% of annually allocated funds would cover the department's and the designated entity or entities, personnel, indirect or other costs to administer the program, and that administrative costs could include necessary system modifications and enhancements. We also understand that the allocated funds would supplement, not supplant, the department's annual Federal Administration for Children and Families allocation for child care, including the Child Care and Development Fund, Child Care Scholarship Program, and the CCDF discretionary funds supporting quality child care. We understand that the manager of the fund would collaborate with the department to leverage resources allocated for program quality improvement through the Granite Steps for Quality, which is New Hampshire's quality recognition and improvement program. We also understand that the manager of the fund would collaborate with the department to leverage resources from the department's proposed ARPA discretionary fund plan for sustainable sector strengthening and strengthening the workforce with respect to recruitment, retention, and professional development strategies. This is a plan that the department has been working on for several months, which included a vast amount of stakeholder input over a 6-month period that collectively determined the top priorities for the ARPA discretionary funds that we've received in the amount of almost $30 million from ACF. The legislation proposes to utilize the American Rescue Plan Act of 2021, ARPA federal funding, if it's available. However, absent the approval of ARPA funds, the department anticipates significant state expenditures to stand up the proposed fund, including the need for additional staff and other related resources necessary to implement the requirements of the legislation. It also assumes, importantly, that eligible child care employers in the state would not fluctuate. So calculating cost based on the number of providers in a changing environment could make it difficult to predict costs over time. Of importance, too, is that the proposed legislation would move contractual obligations with an organization known as State Early Learning Alliance of New Hampshire into the statute. In the event that State Early Learning Alliance of New Hampshire were no longer available or able to meet the requirements in the statute, the department would not be able to procure services from an alternative provider. So the language in the bill essentially results in a sole source provider written into the statute, which is contrary to state policies and contrary to the process for our open and transparent competitive procurement process. We note that the proposed legislation requires the department to incorporate in its biennial appropriation request pursuant to RSA 9:4 an amount necessary to fully fund the Child Care Workforce Fund grant program established in that section. And last, I want to note that the proposed legislation also states that the fund shall be non-lapsing, continually appropriated to the department for the purposes of that section, and that the state treasurer would invest monies deposited into the fund as provided by law. Interest earned on monies deposited in the fund would be deposited into the fund. And I want to defer to Ms. Lorden to provide further information about that item.
Thank you. So in terms of non-lapsing, 45 CFR 92.23B, notice of grant awards have specific time limits, so they expire. We couldn't have them as non-lapsing. The other point on actually investing federal dollars, if you receive more than, or if an agency receives less than 500 in interest, they may keep that. Otherwise, we have to return it to the federal government.
Questions of the department? Senator Whitley.
Yep, thank you, Mr. Chair. Thank you for that, those issues. So certainly we can look at, similar to that we did yesterday about, nothing in this statute shall prohibit. So I'm happy to add that language if, and I see Attorney Williams is shaking his head. So if you don't mind getting that language, I'm happy to address that issue. I'm not as familiar with the lapsing issue, so if you don't mind addressing that, sending me that CFR, and if there's any proposed language to address that issue, we certainly don't want to violate federal law at all.
Right, of course. Yeah.
So happy to make those changes.
Okay, very good. All right, I'm
Thank
going
you.
to turn this over to Senator Gray for the balance of the day. Obviously, there'll be no execing today. See you all next week.
Howell?
Good afternoon. How do you do? My name is Jackie Cowell. It's nice to see you again. I'm from Early Learning, New Hampshire, and I'm here to talk in support of Senate Bill 446. And I have to share with you, first, Fred Coker asked me to submit some testimony on his behalf, so I will be doing that. It's a great letter of support. I hope you see it. He did feature it on his show, this bill, his New Hampshire's business show on WMUR TV. And so he's written in support. He says, I urge you to give serious consideration to the bipartisan legislation SB 466 as an urgently needed underpinning of New Hampshire's child care programs in the interest of New Hampshire's workforce and economy. So thank you. He asked me to share that on his behalf. I'm also here to share with you a letter that was asked as a sign-on letter of support for this bill. It was distributed widely to child care programs and parents and businesses throughout the state. And we'd like to share this with you today. And in terms of being in support of SB 446, and why, there's about 1,894 signatures from throughout the state, and 49% of them are from parents and grandparents who care about this issue and want to have a solution, want to find some kind of solution, something else to add to this scaffolding that needs to happen to try to support the workforce behind the workforce. So I will be sharing that with you. And so just really quickly, top of the letter are some logos of the organizations who sent that out widely for folks to sign on to this letter. I'll just read them to you. So my organization that I work for is called Early Learning New Hampshire. It was just referenced by Karen Hebert. I'd like to talk about that. The New Hampshire Community Loan Fund, Moms Rising, the New Hampshire After School Network, the New Hampshire Advisory Council, which is a legislatively enacted body, Save the Children Action Network, the State Early Learning Alliance, which is in the bill. That is a program of Early Learning New Hampshire. And the reason that the State Early Learning New Hampshire was put into this bill is because it shows up in the New Hampshire Early Childhood Strategic Plan for the state of New Hampshire, a public-private effort of a lot of stakeholders put it together, and it came out in June 2020. And what's in there is recommended. It's one of the recommendations that was in the New Hampshire Strategic Plan for Early Childhood, that specific work around the State Early Learning Alliance, SELA, which was referenced. And then also the Alliance, the YMCA Alliance of Northern New England. And then very quickly, it was also referenced about the wide stakeholder input to the priorities for the ARPA discretionary funds. And I want to just reiterate that really was a very wide process. There were priorities, and the top priorities that kept coming out is to help us retain and recruit the workforce. It came out over and over again. What can we do? As it was pointed out in the bill, every industry is facing this, a lack of staffing, and the childcare is no different. What is different is that the childcare helps other industries report to work and stay on the job. So, because you're running late, thank you very much.
Okay, the questions from senators. Senator Whitley.
Just a quick question on the SELA comment. Would you be amenable to an amendment that just makes it clear that, you know, if SELA did not exist anymore,
Sure.
you sort of addressing the prohibition against the
Of
sole
course.
source contract?
Yeah.
Thank you very much.
Seeing no additional questions, thank you very much.
Thank you.
Barter. Mary Ann.
Thank you. Hello. I'm Mary Ann Barter. I'm the chair of the Child Care Advisory Council, and I'm the executive director of Merrimack Valley Daycare Service in Concord and Blueberry Express Daycare in Pittsfield. The Child Care Advisory Council strongly supports this bill. The child care field in New Hampshire has received some tremendous support from our DHHS partners over the last couple of years, where federal funds have filtered into programs to help sustain them. And although that support has been wonderful and has truly helped, what is really keeping us from being able to recover is the ability to hire staff. So the support that we've received in the past, the financial support that we have received, has helped fill the holes in our financial losses that we have faced. I myself faced losses of, I had months that I was negative $100,000 at the end of the month. It was extraordinary, the financial losses we have faced. And in order to recover from that, we have used our, I have asked and received so many different funding sources, federal funds from DHHS, charitable foundation funds. All of those funds have gone to filling up the holes. You cannot suffer those sorts of losses and those sorts of financial deficits and still support the workforce. We have to choose. So as a child care provider, I'm trying to keep my child care agency alive. And I cannot do that and provide the supports that the child care workforce needs in order to retain their work. I know my staff get asked every day to take another position. I know they do. I have staff who every day drive to work and they drive by Dunkin' Donuts that pays more than I do, or Target that pays more than I do. I believe I have an agency where it's very pleasant to work. And I believe I have an agency where I have a dedicated workforce who love doing this work. I just want to make it possible for them to continue to do so. And this bill would be a lifeline for that. So, any questions?
Thank you. Questions? Seeing none?
All right, thank you so
very
much.
Murphy.
My name is Mark McMurphy. I'm the Executive Director of White Birch Center in Henniker, New Hampshire, and we do childcare, school-age programming, and senior programming. I'm speaking in favor of the bill. 10 years ago, I knew nothing about childcare, absolutely nothing. I was a national account manager for a very large medical products distributor. I had one customer, which was the second largest air medical company in the world. And that's all I knew, and I loved it. But over the years, having worked for manufacturing companies and venture capitalists, publicly traded companies, private companies, I settled in the area, and I was asked to sit on the board of this local nonprofit, White Birch Center in Henniker. And I knew they weren't asking me for my child care expertise because I had none. But I did have business skills and organizational skills. And a year after I was on the board, the executive director left. And we were scrambling. And I was asked by the board if I would be the interim executive director. Well, we found a new executive director. So I took it. I promised I would learn everything I could about childcare as quickly as I could. And here I am 9 years later. I'm still the executive director. But it's a job that I really love. But what I found out 10 years ago or 9 years ago when I took this job, and I think what the public has found out and businesses have found out during the pandemic, is the economy really can't run efficiently without childcare, without access to childcare. You know, if a business's employees can't find childcare, then those employees can't work, and the business suffers, and the economy suffers. Likewise, if a family can't find affordable childcare, they can't work, and the economy suffers. And that's been apparent to me, having done this now for the last 8 years, and now I think it's more broadly known. So childcare, it's an essential business, and it requires qualified, credentialed people working in the industry. But the wages, like Marianne said, are not very competitive. They're comparable to fast food workers. And so if we want to make childcare stable and provide the service that really is essential to the economy, we have to find a way to keep these employees in place in childcare. It's critical. And I think this bill recognizes the importance of the childcare workforce to the economy, and I think it rightly takes steps to stabilize these essential workers. So that's why I'm here, and that's my testimony. Are there any questions?
Thank you. Senator Whitley?
No question. I just wanted to thank you for all your work. You also educated me, actually, as a candidate, a lot about this industry and about sort of, you know, what we can do to improve the business model. So I'm grateful for you.
You're welcome.
Thank you very much. Tremblay. Shannon.
Hi, thank you. Hello, my name is Shannon Tremblay. I'm the director of Little Blessings Child Care Center in Portsmouth, as well as the vice chair of the Child Care Advisory Council. Please excuse me, as this is my first time ever testifying. I want to first thank you, Senator Whitley, and sponsors of the bill for your hard work and dedication to early childhood education and the child care workforce. And thank you to the committee for listening to our testimonies today. I miss the days of classrooms full of children and meeting new families as they come to our center in hopes of being able to enroll their child. Little Blessings has always had a reputation for long wait lists to get a spot. Unfortunately, now we have long wait lists because we don't have staff. These days, I walk by darkened classrooms where children were once happily engaged in fun learning activities. Mornings are spent hoping that nobody is called out and rearranging schedules in order to meet state ratios. Our enrollment is down 60%. We haven't been able to enroll any new families in our program in over a year due to staffing. We are barely making room for new siblings of our older children. Without staff, we cannot open classrooms. Without staff, we cannot enroll children. Without staff, we cannot meet the needs of families who desperately call looking for care. When I first started at Little Blessings, we had roughly 25 full and part-time staff. Currently, we have 12 staff members, and only 4 of those are full-time qualified teachers. We're thankful for every day we don't have to close another classroom or lose another staff member. The effects of the pandemic continue to hit hard. The past 2 years have been a roller coaster ride, and not the happy, fun one. This one's white-knuckled, dark, scary, loop-de-loop ride with twists and turns you can't see coming. Directors and teachers are exhausted, emotionally, mentally, and physically. It's a struggle to put your whole heart and soul into your career every day, only to be left feeling like you're on your own little island and nobody speaks your language. This bill could not have come at a better time. We cannot afford to lose any more valued teachers. In fact, this bill has the ability to strengthen and rebuild New Hampshire's childcare workforce. We recently invited Executive Counselor Janet Stevens to tour our facility and had a lengthy discussion about the need to not only show the value in childcare, but the effects on every other business. When she was leaving, Counselor Stevens even offered to substitute for us. Every business relies on childcare in order to retain their employees. I've been getting calls from HR departments who are looking to hire a candidate, but that person cannot find childcare and therefore cannot accept the position. Every day we have an average of 6 to 8 calls or emails from parents desperately looking for childcare. We must tell them that we don't have any idea when we'll have an opening, as it all depends on being able to find, hire, and retain staff. We need this bill. New Hampshire's childcare industry needs this bill. New Hampshire's families need this bill. Thank you for your time today and for your continued support.
Questions? Seeing none, thank you very much.
Thank you.
Next on the list is Willett. Lynn?
Good afternoon. Thank you for having us. My name is Lynn Willett. I am the director of Nellie's Treehouse in Amherst, New Hampshire. This is my passion and my career. I've done it for 40 years. And in my 40 years, I've been a teacher and a director. This current staffing crisis is hurting all of us, as you heard my colleague Shannon speak to. We want to thank each and every one of you for being here and taking the time to listen to us. During my career, there's always been staffing issues off and on, but I've never seen it to this extent. We lose staff members to work at Target because we can't pay them enough to stay with us. The need for childcare workers has grown tremendously, but we need to have good benefits and good rates of pay to retain them in our field. For our children and our parents, it gives them peace of mind when they can leave their child in a consistent environment with a consistent individual. They know their children are safe and well cared for. We don't have that consistency right now. I have 19 staff, of which currently I have 15. I myself cook and fill in those classrooms for those children because they need consistency. So we are 4 staff members short. It took me 6 months to find a teacher who could take over for my 4- and 5-year-old classroom, who is qualified and can do the job well. We need to retain our staff. We need to recruit new individuals, and we can't afford to lose any more staff. Childcare is the workforce behind the workforce. We have a wait list of 62 children. I get at least 6 or 7 calls a week from parents on that list saying, please tell me you have a space. And they just don't have that space, and it is due to staffing. It affects everything for our parents. If we have too many staff out for any reason, then we have to close the classroom for a period of time, and that's never good for our children. Children need quality environments that provide consistency. They need caregivers who provide a nurturing environment, and parents need to have a sense of safety and comfort. Constant changes in their caregivers or lack of education in those caregivers puts our field at risk and puts our children at risk. Children need healthy, stable attachments, and we can't do that when we can't hire quality, educated staff. The child care workforce needs to stabilize. We need to rebuild ourselves. This bill offers an opportunity for the field to do just that. It allows us to recruit, hire, educate, and retain our staff. Our workforce is dedicated, they're educated, they're professional, and we hope that you will consider this bill. Our children deserve it. They deserve the opportunity to have quality teachers. And we hope that each and every one of you will strongly consider this bill for our New Hampshire's children and even for our future workforce.
Okay, thank you. Are there questions? Seeing
Thank
none,
you.
thank you very much. New Hampshire Women Foundation, Ms. Paradise? Would you see if New Hampshire Women's Foundation, Ms. Paradise?
Thank you. Good afternoon. My name is Crystal Parody. I'm the Director of Strategic Communications and Community Engagement for the New Hampshire Women's Foundation, and I have some written testimony I'll be submitting as well. As you will see in the written testimony, we are here to urge you to ought to pass this bill, Senate Bill 446. As you will see with the testimony, women are the most impacted by the child care industry, both as the providers and those who rely on its service. New Hampshire women make up 86% of the employees or the workers in the child care and social services industry. And these women, child care workers, serve the families who are working in essential services. Those workers are also women. 79% of healthcare workers and 51% of grocery and retail workers are women. Without access to childcare, women are the ones who have had to reduce hours or leave the workforce in greater rates as men. And you'll see cited there in your handout that mothers have had to take 4 to 5 times greater reductions in their work hours than fathers' reduction in work. And between September 2021 and January of 2022, 15% of Granite State workers who are out of the labor force cite childcare as the primary reason for not working. 53% of New Hampshire unemployment claims during the pandemic have been from women. SB 446 provides a transfusion into a workforce that is the under-supported foundation to our economy. And this bill will have positive impacts on the workers of the childcare industry, the women who rely on the childcare industry, and the families and communities supported by working women. The workforce behind the workforce is female, and this bill supports Granite State women who keep this state running. Thank you for your consideration.
Questions? Seeing none, thank you very much.
Thank you.
State work play New Hampshire, Stuart, Will? And if you check the list to see if there's anybody signed up on the other sheet. Welcome.
Thank you, Mr. Chairman, members of the committee. For the record, my name is Will Stewart. I'm the Executive Director of Stay Work Play New Hampshire, which is a statewide nonprofit whose mission is to attract and retain more young people here in the Granite State. And that's necessary for a couple of big reasons. One, we're the second oldest state in the country at present, and 2, even pre-COVID, we had one of the lowest unemployment rates in the country, and that's just been exacerbated during the current crisis. It's a long way of saying that we need more people in general, and we need more young people in particular. We need more young people to serve as employees for the state's employers, to serve in vital positions in our communities, in our nonprofits, everything we need to make our society here in New Hampshire work. We need more people to do that, and again, more young people in particular. We are in support of this bill because childcare, as has been noted by all of the speakers previously, I think have used the phrase, the workforce behind the workforce. Young people and others can't go to work, and parents can't go to work if they don't have adequate childcare, for their children to do so. They also can't take on the roles that our civic society here in New Hampshire requires us to do in a largely volunteer state. So for these reasons, we're in support of it. While I'm here, I also have to leave. I was going to be speaking in support of the next bill with regard to a commission to study housing barriers. And I think, my testimony would be similar for both and for adequate, for the same reasons for both. And I'll leave you with this comment that still kind of haunts me a little bit to this day. Stay Work Play a couple of years ago, right pre-pandemic, we were going around the state talking to young people about reasons they stay in New Hampshire and might leave. In this case, their particular regions. And this one night we were up at Salt Hill Pub up in Lebanon and speaking to people, young people all across the Upper Valley. And this one young woman said something. She said, the Upper Valley, and I think this applies to New Hampshire writ large, but she said, the Upper Valley is a wonderful place to raise a family. She said, but it can be an incredibly difficult place to start one. And I think that's where we are right now here in New Hampshire. It's such a wonderful place. I love raising my family here, but if you can't find a place to live, if you can't find childcare, that can be a challenge. And anything we can do to help minimize those challenges, I think we ought to be doing for not just for the people themselves, but for the economy, for the businesses, for everything in New Hampshire. Thank you.
All right, questions from the senators? Seeing none, thank you very much. And at this time, we'll close the public hearing on Senate Bill 446. And since we have the prime sponsor, we will open the hearing on Senate Bill 329 and welcome the prime sponsor. Welcome, Senator.
Good morning. Thank you. Okay. And actually, you have copies of the amendment? Okay. Thanks, Cam. Good morning. I stand between you and lunch, so let me get you through this hearing. Good morning. For the record, I'm Senator Rebecca Perkins-Quokka, representing District 21 of Portsmouth and the surrounding towns. Prime sponsor of SB 329, which asks for commission to study barriers to housing development in New Hampshire, including workforce and middle-income housing. As we all know, New Hampshire is experiencing a housing crisis. The lack of supply of housing, including workforce and middle-income housing, is threatening New Hampshire's economy, driving our workforce out of the state and increasing homelessness. You've heard me say this before, but we have a less than 1% vacancy rate across the state. The median sales price for a home is now over $400,000, and in my home county, it's over $500,000. There's simply not enough housing inventory to meet demand. And according to the U.S. Department of Commerce, New Hampshire is also experiencing a major decrease in new building permits. Although there's a lot to be concerned about, there's a lot of solutions in play, including increased investments in the state's Affordable Housing Fund, the new Housing Appeal Board, SB 400, which Senator Bradley and I are working closely together on, and many business leaders like BIA, Dartmouth Hitchcock, and the Workforce Housing Coalition of the Greater Seacoast are stepping up with resources. Although there have been prior commissions that have discussed the housing shortage, there has not been one that directly studies the barriers to workforce and middle-income housing. My predecessor, Senator Martha Fuller Clark, chaired a study commission on issues related to density, and another commission about 10 years ago, proposed by Senator Bob Odell, focused on construction and regulatory issues. This new commission, proposed in SB 329, has an opportunity not only to identify current challenges, but also evaluate how new proposed solutions are working. I would also like to propose the amendment circulated, which is 0324S. This amendment simply has the effect of adding one member to our commission, which is a workforce housing developer appointed by the governor. And we'd like that addition to make sure the commission is looking holistically at the issue and has all perspectives. I will leave it at that, Mr. Chair, and happy to take any questions.
Questions from the senators? Seeing none, thank you very much.
Thank you.
And I believe that Mr. Stewart from Stay Work Play said he was combining his, so we'll check him off. The next is Business and Industry Association. Rick, you're right.
Good afternoon. Thank you very much for allowing me to speak today. I'll submit my written testimony, and out of respect for your time, I will offer an abbreviated version of it. I'm Rick Fabrizio, Director of Communications and Public Policy for the BIA, which is New Hampshire's statewide Chamber of Commerce and leading business advocate. BIA has long been involved in advocacy for workforce housing because a diversified housing stock is critically important to New Hampshire's economic vitality. We strongly support passage of Senate Bill 329 and ask that BIA be added as a representative of the Commission. the one most important point I would make, which falls on the heels of the childcare effort, if young people can't afford to rent adequate rental properties or buy homes, a lot of them will eventually look outside the region, outside of the region being New England, look for places where they can. New Hampshire's population is falling off from the bottom of the age spectrum, and that poses the biggest threat of all to New Hampshire's economy in the long term. Thank you for letting me provide my written testimony and some brief comments. I'll happily take any questions if you have any.
Questions from senators? Okay, thank you very much.
Thank you.
Before you go, Senator, we just had a suggestion to add BIA to the list of people, which would include on your amendment. Comments?
I'm very open to that.
Okay, thank you very much. And now we'll move on to Jack, New Hampshire Housing something
Finance Authority.
All right. It didn't look like finance to me, so.
Thank you, Mr. Chairman.
All right.
And members of the committee, I have atrocious handwriting. I'm a lefty. And so you aren't the first to have trouble figuring out what I've written. For the record, my name is Jack Ruderman, and I serve as the Manager for Public Affairs at the New Hampshire Housing Finance Authority in Bedford. We're also known simply as New Hampshire Housing. I am here today in support of SB 329. The reason that New Hampshire Housing supports this bill is pretty simple. As you've heard from prior speakers, there is an ongoing acute housing crisis in our state that shows no signs of abating anytime soon. And there is an urgent need to find new ways to increase the supply of housing, in particular workforce and middle-income housing. New Hampshire Housing was an active participant in the Density Commission that Senator Perkins-Cuoco referenced in her remarks. We believe that that commission covered a lot of ground and made some important headway in better understanding the barriers to developing more housing. But due to the time lost to COVID in 2020, the commission was unable to finish its work, hence the need for this bill. So again, we're pleased to support this bill, appreciate the opportunity to testify, and I also wanted to note that Tom DeRosa of Housing Action New Hampshire had hoped to be here to speak, but has a scheduling conflict. He was drawn away. But he did want me to let the committee know that Housing Action New Hampshire supports this bill and believes that this study commission would differ from the prior commission in that it is focused more on middle income and workforce housing. And in any event, they want to be on record as supporting this bill.
Okay, thank you very much. Questions? Seeing none, thank you very much. We'll close the hearing. I'll entertain a motion going into executive session. He said I could exec this one. He told me I could. We had a motion going into executive session. Do I have a second? All right. We have a motion second to go into executive session. Do I have a motion on Senate Bill 329?
I move OTP.
And good? Yeah, we'll just move an OTP, and then we'll have the motion for the amendment as modified.
I move amendment 0324S with the addition, I guess it would be H, one representative of the.
Senator, can you turn your microphone on?
Gosh.
Say it again.
To add a representative from the BIA appointed by the BIA.
Right.
I'll second that.
Is there any discussion? Is there any? We'll vote on the committee amendment. All those in favor say aye.
Aye.
And opposed? All right, we have the motion ought to pass as amended. Any discussion? Seeing none, all those in favor say aye.
Aye.
And who would like to take that out? I'll take that out. Sherman. Do I have a motion to come out of executive session?
Second.
Second. And all those in favor say aye.
Aye.
And our business being completed, I close the session.
You need a blurb now? And this is the blurb for, I'm